catching colds more often, or even feeling less connected to your partner. What many older adults don't realize is that these changes are often linked to decreased sexual activity. In this article, we'll explore 5 important ways your health and well-being can change when sex slows down after 70, and what you can do to stay vibrant, healthy, and emotionally connected as you age. Whether you're married, dating, or single, understanding this connection can help you make better choices for your health and happiness. Your hormone levels drop faster after 70, and why it matters for seniors. As we age, hormone levels naturally decline, but for many Americans over 70, the absence of regular sexual activity can accelerate that decline in ways that directly impact health, energy, and quality of life. Why testosterone matters for seniors. Testosterone is often labeled the male hormone, but it is essential for both men and women in their later years. In men, it helps maintain muscle mass and physical strength, critical for mobility and preventing falls, reducing the risk of fractures and osteoporosis. Energy and vitality, combating age-related fatigue, cognitive sharpness, supporting memory and focus. For women, healthy testosterone levels are equally important. Low testosterone in older women can contribute to reduced muscle tone, low energy, and decreased mental clarity, making everyday activities more challenging. The role of estrogen in older women. Estrogen plays a crucial role in women's health after 70, far beyond reproductive function. It helps maintain skin elasticity and hydration, contributing to a youthful appearance and comfort. Bones, protecting against age-related bone loss, keeping arteries flexible and reducing heart-related risks. Mood and cognitive function, helping stabilize emotions and support memory. When sexual activity slows or stops, estrogen levels may decline faster, leaving many older women more prone to mood swings, irritability, and mental fog. Sexual activity as a natural hormone booster. For seniors, sexual activity acts like a natural hormone regulator. Intimacy triggers the body to release and balance hormones, helping maintain higher, healthier levels of testosterone and estrogen. Without that stimulation, age-related symptoms, such as muscle loss, fatigue, depression, and memory problems, can appear earlier and feel more intense. Robert's story. Robert, a 73-year-old retired engineer from Ohio, experienced this firsthand. After losing interest in sex following his wife's passing, he started feeling constantly tired and mentally foggy. Concerned, he visited his doctor, who discovered that his testosterone levels were unusually low for his age. With proper medical guidance, Robert adopted a hormone-friendly lifestyle. He started walking daily, added strength training exercises, focused on a protein-rich diet, and discussed hormone replacement options with his doctor. Within months, his energy improved, his mood stabilized, and his mental clarity returned. What seniors can do to support hormone health. Sex isn't the only way to maintain hormone balance after 70, but it's an important piece of the puzzle. If sexual activity has slowed, you can still protect your hormones. Staying physically active, strength training, yoga, or even brisk walking can stimulate hormone production. Meditation and relaxation techniques reduce cortisol, which interferes with testosterone and estrogen. Eating a nutrient-rich diet, healthy fats, lean protein, and zinc-rich foods support hormone health. Talking to your doctor, regular blood tests can help monitor hormone levels and discuss safe options, including lifestyle changes or hormone replacement therapy when appropriate. The key takeaway for Americans over 70. Sexual health isn't just about intimacy or pleasure, it's a powerful signal to your body to stay strong, energetic, and mentally sharp well into your golden years. Whether through physical intimacy, exercise, or other lifestyle changes, keeping your hormone levels balanced after 70 can dramatically improve how you feel every single day. Your heart loses a natural work. Why intimacy matters for seniors' heart health. When most people think about heart health after 70, they focus on diet, walking, or medication. But few realize that regular sexual activity is one of the most natural and enjoyable cardiovascular workouts you can give your body. Sex after 70 is more than a source of closeness or pleasure. It's also a powerful way to keep your heart strong. Every intimate encounter gently challenges your cardiovascular system in the same way light aerobic exercise does. How sex supports heart health after 70. During intimacy, your body experiences a unique combination of physical and chemical changes that directly benefit your cardiovascular system. Sexual activity temporarily raises your heart rate, giving it a mild but beneficial workout similar to brisk walking. Improved blood vessels dilate, promoting better circulation and oxygen delivery to vital organs. Lower blood pressure over regular sexual activity has been linked to healthier blood pressure regulation. Stronger, More flexible sexual activity stimulates the release of nitric oxide, a compound that helps keep your arteries open and elastic, reducing strain on your heart. This natural cardiovascular boost is especially valuable for seniors because it improves circulation and helps maintain overall energy levels. What happens when sexual activity stops? When sex becomes infrequent or stops entirely, your body loses this heart-friendly stimulation. Over time, that can lead to noticeable changes, poorer circulation and slower wound healing, higher fatigue levels and decreased stamina, increased blood pressure or difficulty controlling it, more frequent erectile dysfunction in men due to restricted blood flow, vaginal dryness and discomfort in women, also linked to reduced circulation. A real-life example. Take Joan, a 76-year-old retired schoolteacher. After her husband passed away, she gradually became less active and intimacy disappeared from her life. Within months, her energy dropped and her blood pressure rose. Her doctor explained that the decline in physical activity, including the loss of sexual activity, was partly to blame. Joan joined a gentle exercise class and started socializing more, which improved her heart health and mood. While she didn't return to sexual activity right away, staying physically and socially active helped her regain energy and confidence. What you can do if sex isn't part of your life. If you're no longer sexually active, there are still ways to give your heart similar benefits. Daily walking or light aerobic exercise to stimulate circulation. Gentle stretching or yoga to improve flexibility and blood flow. Social engagement and emotional connection to reduce stress, which is critical for heart health. However, don't underestimate the unique combination of physical and emotional benefits that intimacy provides. For those who are comfortable and able, sexual activity remains one of the most natural ways to support cardiovascular health after 70. Even non-sexual forms of affection, such as hugging, kissing, or simply holding hands, can release feel-good hormones, lower stress levels, and contribute to overall heart wellness. The bottom line. For seniors in America, where heart disease remains a leading health concern, maintaining intimacy can be a simple yet powerful tool for staying healthy. Whether through sex or other heart-healthy habits, keeping your cardiovascular system active is key to feeling energetic, reducing health risks, and enjoying life to its fullest. Your immune system. Why sexual activity matters for seniors in America. Many older adults are surprised to learn how strongly sexual activity supports the immune system. It's not just about intimacy or pleasure. It's about giving your body a natural boost to stay healthier as you age. During sexual activity, your body releases powerful hormones and chemicals, including oxytocin, dopamine, and endorphins. These aren't just feel-good chemicals. They actively reduce stress, lower inflammation, and stimulate your immune response. In fact, research shows that people who have regular sex tend to have higher levels of immunoglobulin A, an essential antibody that helps fight respiratory infections, colds, and even certain digestive issues. For seniors, this immune-boosting effect can be especially valuable. As we age, our immune system naturally becomes less efficient, making us more vulnerable to infections, slower recovery times, and lingering fatigue after illness. Sexual activity acts as a natural defense mechanism, helping your body respond more effectively to viruses and bacteria. What happens when sexual activity declines after 70? When intimacy slows down or stops altogether, you may notice more frequent colds or respiratory infections. Your immune system loses some of its natural defenses, making you more likely to get sick. Longer recovery times after illness, cuts, bruises, and even seasonal flu may take longer to heal. Lowered resilience and energy. You might feel tired more often, even if you're eating well and getting enough rest. This doesn't mean sex is the only factor in immune health, but it's an often overlooked piece of the puzzle for older adults. A real-life Walter's story. Walter, a 79-year-old retired accountant from Ohio, noticed he was catching colds every other month after he and his wife stopped being intimate. His doctor explained that age-related immune decline, combined with higher stress levels and reduced physical connection, was likely making him more susceptible to illness. Walter decided to take action. He focused on improving his sleep routine, adding moderate daily exercise, rekindling physical and emotional closeness with his wife, through hugging, holding hands, and eventually becoming sexually active again. Within a few months, Walter reported fewer colds and felt stronger and more energetic overall. His experience highlights how important connection, both emotional and physical, can be for your health. Intimacy beyond sex. What seniors can do. You don't have to engage in frequent or vigorous sexual activity to see benefits. Even non-sexual touch, such as hugging, cuddling, or holding hands, can help lower stress hormones and stimulate immune function. For Americans over 70 looking to strengthen their immune system naturally, stay physically active. Walking, stretching, and light resistance training improve circulation and help immune cells work better. Eat nutrient-rich foods, include vegetables, fruits, lean protein, and omega-3 fatty acids to support overall immunity. Get quality sleep. Deep rest allows your body to repair and fight infections. Nurture emotional closeness. Physical affection and social interaction release oxytocin, which has been linked to stronger immune responses. Why this matters for seniors in America. Older adults in the U.S. face higher risks of chronic illnesses and infections, especially during flu season and in colder climates. While vaccines, healthy eating, and exercise are essential, maintaining some level of physical intimacy adds another layer of protection. The takeaway is clear: whether through sex or simple affectionate touch, staying connected to others can keep your immune system strong, reduce your chances of getting sick, and help you recover faster. How a decline in sexual activity after 70 can affect your mood and memory. Sex isn't just a physical act, it's one of the most powerful ways your body supports emotional balance and brain health. For many Americans over 70, a decrease in sexual activity brings unexpected changes in how they feel, think, and interact with others. Why does sexual activity impact mental health and cognitive function? When you're intimate with a partner, your brain releases a natural mix of feel-good chemicals. Dopamine, the reward hormone that boosts motivation and pleasure. Serotonin, crucial for regulating mood and reducing anxiety. Oxytocin, sometimes called the bonding hormone, which increases feelings of connection and trust. Regular sexual activity also stimulates areas of the brain involved in memory, attention, and problem-solving. This stimulation promotes neuroplasticity, your brain's ability to form new connections, which is essential for staying mentally sharp. When intimacy slows down or stops, you lose this natural brain workout, which can lead to more frequent mood swings, anxiety, or even depression. Slower thinking, forgetfulness, and memory lapses. Lower motivation to socialize or engage in stimulating activities. Margaret's story. Margaret, a 75-year-old retired nurse from Ohio, noticed she was becoming more forgetful and withdrawn after losing interest in sex following health challenges. Social gatherings felt exhausting, and her mood dipped into sadness more often. Her doctor explained that the reduced release of these mood-regulating hormones might be contributing to her symptoms. Instead of forcing herself back into a traditional sexual routine, Margaret focused on new forms of intimacy, gentle physical touch, cuddling with her partner, and spending more time in shared activities like gardening and cooking together. Within months, she reported better focus, improved memory, and a noticeable lift in her mood. What this means for seniors in America. The good news is, you don't need to maintain a high level of sexual activity to protect your brain and emotional health. Even non-sexual forms of closeness, such as hugging, holding hands, or spending quality time with a loved one, can trigger similar brain-boosting effects. Simple steps like regularly hugging or cuddling with your partner, staying socially active with friends and family, engaging in mentally stimulating hobbies like reading, puzzles, or learning new skills, practicing stress-reducing techniques like meditation or deep breathing, can help protect your mood and memory as you age. The takeaway. Sex after 70 isn't just about desire or physical pleasure, it's an important part of maintaining mental clarity, emotional stability, and overall happiness. Whether through intimacy, physical touch, or meaningful social interaction, staying connected to others helps keep your brain active and your spirits high. Emotional bonds can fade, and how to keep them strong after 70. Sex after 70 is far more than a physical act. It plays a powerful role in maintaining emotional closeness and relationship satisfaction. For many American seniors, intimacy is one of the strongest ways to feel connected, valued, and emotionally secure. When sexual activity slows down or stops completely, couples often experience a quiet but significant shift in their relationship. Emotional distance does not happen overnight. It builds slowly when physical affection fades. Without those small but meaningful moments of closeness, holding hands, kissing, cuddling, or even casual touches, partners may begin to feel less connected. This can lead to loneliness, more frequent misunderstandings, and sometimes even resentment, even in marriages that have lasted decades. The science behind this is clear. Physical intimacy stimulates oxytocin, often called the bonding hormone. Oxytocin creates feelings of trust, empathy, and attachment. When physical closeness decreases, oxytocin levels drop, making it harder for couples to feel that same deep emotional connection. Over time, this can make a strong, loving partnership feel more like two people simply sharing the same space. Take Evelyn and George, a married couple from Florida in their late 70s. After George developed health problems that affected their sexual activity, Evelyn felt increasingly lonely, even though George was always physically present. They started to argue more and felt emotionally distant. With the help of a counselor, they began finding new ways to show affection, like regular hugs, hand-holding during walks, and open conversations about their feelings. Slowly, the emotional warmth returned, proving that intimacy can be rebuilt at any age. The good news is that emotional intimacy does not have to fade with age. Even if sexual activity changes or becomes less frequent, couples can keep their emotional bonds strong, making physical affection a daily habit. Gentle touches, hugs, or holding hands during everyday activities can help maintain closeness. Sharing meaningful activities, cooking together, taking evening walks, or enjoying hobbies as a team builds a sense of partnership and connection. Talking openly about feelings. Honest communication is one of the strongest tools for keeping emotional intimacy alive, especially when physical intimacy changes. Exploring new forms of intimacy. Couples can redefine what intimacy means to them. Sometimes a quiet conversation before bed or watching a favorite movie together can feel just as connecting as sex. Emotional connection is not just about romance. It is deeply tied to overall health and happiness. Studies show that seniors with strong emotional bonds have lower stress levels, better cognitive function, and even longer lifespans. If you feel emotional distance growing in your relationship, it's important to act early. Whether through counseling, trying new ways to express affection, or simply being intentional about spending quality time together, you can keep your relationship strong and fulfilling well into your 70s, 80s, and beyond. Remember, love and connection do not retire with age. With care, patience, and creativity, emotional intimacy can remain one of the most rewarding parts of life at any stage. The changes that come with less sexual activity after 70 reach far beyond the bedroom. For older adults, the effects touch almost every system in the body. Your hormone balance, cardiovascular health, immune strength, mental sharpness, and even emotional connection with loved ones are all deeply interconnected. When intimacy fades, hormone levels decline faster, the heart loses a natural cardiovascular workout, immune defenses weaken, and mood or memory can suffer. Relationships may also feel less warm or connected, leading to feelings of loneliness or isolation. For many seniors, these shifts can quietly reduce energy, resilience, and overall quality of life. But here's the encouraging part: you have more control than you might think. Intimacy does not have to mean the same thing it did at 30 or 40. It can take many forms, and every step you take to stay connected can improve your health and happiness. Gentle physical activity such as walking or stretching helps replace some of the cardiovascular benefits of sexual activity and boosts hormone balance naturally. Open communication with your partner or even close friends helps maintain emotional bonds and prevents feelings of isolation. Simple physical touch, holding hands, hugging, or cuddling, can trigger the release of oxytocin, often called the bonding hormone, which supports emotional and mental well-being. Exploring new ways to connect, whether through shared hobbies, light physical intimacy, or even massage, can help maintain that sense of closeness and vitality. Aging does not mean giving up on connection or pleasure. Growing older in America often comes with outdated stereotypes about slowing down or losing interest in intimacy. But research and real-life stories from seniors show the opposite. Maintaining physical and emotional intimacy, whatever form it takes, supports healthy aging, stronger relationships, and a more joyful life. Whether you are single, married, divorced, widowed, or somewhere in between, nurturing intimacy after 70 can help you feel more vibrant, with better energy levels and mental clarity, more resilient, with stronger immunity and stress resistance, more alive, with deeper emotional connection and renewed sense of purpose. The bottom line: sex and intimacy after 70 are not just about desire. They are a vital part of healthy aging. By staying informed, adapting to life's changes, and honoring your emotional and physical needs, you can continue to enjoy the benefits of connection well into your later years. It's never too late to take small, meaningful steps toward intimacy. Even if sex is no longer part of your routine, touch, communication, and emotional closeness can provide the same life-enhancing benefits, keeping you strong, healthy, and truly alive at every age. 5 medical tests seniors over 70 should rethink what you really need and what to skip. 5 medical tests seniors in the U.S. should think twice about after turning 70, scientific evidence you need to know. In the United States, older adults are constantly told that routine screenings and regular checkups are the key to staying healthy. It's a message deeply ingrained in American healthcare culture. The earlier, the better. Catching it early saves lives. Don't skip your annual screenings. But what if this well-meaning advice doesn't always apply, especially after age 70? Today, a growing number of physicians, public health experts, and peer-reviewed studies are challenging the one-size-fits-all approach to preventive testing in older adults. The data shows that for many healthy seniors, certain routine medical exams may no longer offer meaningful benefits, and in some cases, they can cause physical, emotional, and financial harm. The truth: more testing doesn't always mean better care. If you're over 70, or if you're helping care for aging parents or loved ones, it's time to ask a critical question. Are all these medical tests still necessary? The answer isn't always. In fact, continuing certain screenings past a certain age may result in false positives and unnecessary anxiety, invasive procedures and follow-up surgeries, over-medication and long-term side effects, rising out-of-pocket costs not always covered by Medicare, no measurable increase in lifespan or quality of life. That's why it's so important to separate truly essential screenings from those that may no longer serve a purpose, and could even backfire. In this science-backed guide, we break down 5 medical tests seniors in the U.S. should carefully reconsider after age 70. If you're an older adult, or advocate for someone who is, this could help you avoid unnecessary procedures, save money, and protect your health. And why full-body CT scans are risky for Americans over 70, what you need to know before booking one. Full-body CT scans are frequently marketed in the United States as premium preventive health checks, often included in executive physicals or elite health screening packages at private clinics. Many Americans see these scans as a way to catch serious health problems early and take control of their well-being. However, the reality is far more complicated and concerning. Full-body CT scans expose patients to very high doses of ionizing radiation, significantly more than standard X-rays. According to a 2023 study published in JAMA Internal Medicine, the cumulative radiation from CT scans may contribute to up to 5% of all cancers diagnosed annually in the U.S. This cancer risk is roughly equivalent to the risk from daily alcohol consumption, highlighting the serious long-term danger. Beyond the radiation risk, full-body CT scans frequently identify benign abnormalities such as harmless nodules, cysts, or calcifications, especially common in older adults. Unfortunately, these findings often trigger a chain reaction of unnecessary medical interventions, including further imaging tests, invasive biopsies, and even surgeries, all carrying their own risks of complications, costs, and emotional stress. For healthy seniors over 70 without symptoms, there is no scientific evidence that routine full-body CT scans improve survival rates or enhance quality of life. In fact, experts including the American College of Radiology strongly advise against the use of full-body CT scans as general screening tools in asymptomatic adults due to these risks. What should Americans do instead? If you're over 70 and concerned about your health, focus on proven strategies for healthy aging rather than high-risk screenings. Maintain a balanced diet rich in fruits, vegetables, and whole grains. Stay physically active with regular exercise tailored to your ability. Manage chronic conditions with your healthcare provider's guidance. Get age-appropriate screenings recommended by your doctor, such as mammograms, colon cancer screening, or heart health evaluations. Discuss any symptoms like unexplained weight loss, persistent pain, or bleeding with your physician for targeted diagnostic testing rather than broad, high-risk scans. Take control of your health wisely. Before scheduling a full-body CT scan, ask yourself, is the scan necessary based on my current symptoms or risk factors? Will the scan result change my treatment plan or improve my health outcomes? Am I aware of the radiation risks involved? If the answer is no or you're unsure, consider consulting a trusted healthcare professional for a personalized evaluation. Avoid unnecessary radiation exposure that could increase your cancer risk and lead to potentially harmful medical procedures. Your health is your most valuable asset. Protect it with smart decisions, not unnecessary tests. Colonoscopy after age 75. Why seniors should reconsider routine screening. Colonoscopy remains the gold standard for colorectal cancer screening in the United States, helping save thousands of lives each year by detecting precancerous polyps and early-stage cancer. However, for Americans aged 75 and older, the benefits of routine colonoscopy decline sharply, especially if previous screenings were normal. At this age, the potential harms and risks often outweigh the benefits, making it crucial to carefully evaluate whether this invasive procedure is right for you. Risks of colonoscopy in seniors over 75. Undergoing a colonoscopy after age 75 involves several serious considerations. The laxatives used to clean out your colon can cause dehydration and electrolyte imbalances, which can be particularly dangerous for older adults with underlying health issues. Sedation during the procedure increases the risk of postoperative cognitive decline, delirium, and prolonged recovery times in seniors. Seniors face an increased risk of complications such as bleeding, infection, and even colon perforation. These complications often require hospitalization and may lead to long-term health consequences. A landmark 2019 study analyzing over 1.3 million Medicare beneficiaries found that for every 1,000 colonoscopies performed in adults over 75, only 2 lives were saved, while more than 20 patients experienced serious adverse events. This data highlights the delicate balance between potential life-saving benefits and real risks in elderly population. What are safer alternatives to colonoscopy? If you are over 75 and have had regular normal colonoscopy results in the past, you may want to discuss alternative screening options with your healthcare provider. Fecal immunochemical test. This stool-based test is non-invasive, can be done comfortably at home, and does not require bowel prep or sedation. It detects hidden blood in the stool, a common early sign of colorectal cancer. Stool DNA testing, another at-home option that analyzes DNA markers in stool samples, offering high sensitivity for detecting cancer and precancerous lesions without the risks of invasive procedures. Talk to your doctor today. If you're an American senior over 75, don't agree to routine colonoscopy without fully understanding the risks and benefits. Make an informed decision by discussing your personal health history, previous screening results, and risk factors with your doctor. Ask about non-invasive screening tests like the FIT or stool DNA tests, which offer safer, effective alternatives for colorectal cancer detection in older adults. Prioritize your health and quality of life by choosing screening methods that fit your unique needs. Remember, your age, overall health, and screening history matter. Colonoscopy after 75 is not a one-size-fits-all solution. Stay informed, stay proactive, and partner with your healthcare provider to make the best choice for your longevity and well-being. While this test is commonly used to detect heart problems, many older adults in the U.S. without clear symptoms of heart disease may face more risks than benefits from this procedure. Cardiac stress tests without symptoms can do more harm than good. Research shows that in adults over 70 who don't have classic heart disease symptoms, like chest pain during exercise or shortness of breath, the false positive rate for stress tests can be as high as 40%. This means nearly half of these tests may incorrectly indicate a heart problem when there isn't one. These false positives often lead to follow-up procedures such as angiograms, stent placements, or even bypass surgeries. Unfortunately, studies confirm that these invasive interventions do not improve survival rates or quality of life in asymptomatic seniors. Worse yet, these procedures come with significant risks, including bleeding complications, kidney damage from contrast dyes, and extended hospital stays. For many seniors, these side effects can result in a decline in independence and overall health. Safer and smarter alternatives to stress testing for seniors. If you don't have obvious signs of heart disease, it's important to discuss safer, more effective diagnostic options with your doctor. Resting electrocardiogram, a quick, non-invasive test that measures your heart's electrical activity while at rest. Coronary calcium scan, a low-radiation CT scan that detects calcium buildup in your arteries, helping assess your risk of heart disease without invasive procedure. These tests have a lower risk of complications and often provide clearer information to guide your healthcare decisions. Take control of your heart health, ask the right questions. If you're a senior American concerned about your heart health, don't automatically agree to a cardiac stress test. Before proceeding, ask your healthcare provider. Do I have any clear symptoms of heart disease that justify this test? What are the risks associated with the cardiac stress test in my age group? Are there safer alternatives better suited for me? Your health is your most valuable asset. Make informed decisions by focusing on evidence-based medicine and personalized care. Remember, true heart disease prevention after 70 isn't about routine stress testing. It's about smart, individualized medical guidance and lifestyle choices. It's common for family members and seniors themselves to worry about early signs of dementia or Alzheimer's disease. Because of this, Doctors often order brain MRI scans to check everything to catch problems early. However, the reality is more complex. Research published in Neurology Today in 2021 highlights that 97% of older adults who received brain MRIs due to mild cognitive complaints showed no treatable abnormalities. Most findings on these scans, such as white matter hyperintensities, small spots, or slight brain shrinkage, are actually normal age-related changes and do not mean dementia or any serious neurological condition. Unfortunately, these normal findings often cause unnecessary anxiety and lead to more invasive follow-up tests like lumbar punctures, spinal taps, expensive PET scans, or even brain biopsies. These procedures come with their own risks, including infection, bleeding, and increased stress. If you or a loved one in the US over 70 are experiencing mild memory issues, here's what to do. Start with a simple cognitive screening test during your primary care visit. Tools like the Mini Mental State Exam or Montreal Cognitive Assessment provide reliable, low-risk ways to evaluate brain function. Focus on proven lifestyle strategies to support brain health, prioritize quality sleep, stay well hydrated, engage in regular physical exercise, and challenge your brain with puzzles, reading, or social activities. Talk openly with your healthcare provider about your symptoms and concerns. Ask if brain MRI is truly necessary or if monitoring over time with lifestyle adjustments is the safer, more effective route. Don't rush into expensive and potentially harmful imaging just because memory lapses worry you. Early detection is important, but so is avoiding unnecessary tests that don't improve your health and may even cause harm. Take control of your cognitive health today by choosing smarter, evidence-based steps. Contact your primary care physician to schedule a cognitive screening, and commit to lifestyle habits that help keep your mind sharp for years to come. 5. Why routine bone density scans after 70 may be doing more harm than good. In the United States, bone density tests are widely used to screen for osteoporosis, particularly among postmenopausal women and older adults. But here's what many Americans over 70 aren't being told: even in healthy seniors with no history of fractures or falls, these scans almost always show some degree of bone loss, not because of disease, but simply due to normal aging. This often leads to a troubling cycle. A scan shows osteopenia or mild osteoporosis. The patient is prescribed medications like bisphosphonates. The drugs trigger dangerous side effects, without significantly reducing fracture risk. According to a major study published in the Journal of the American Geriatric Society, treating age-related bone loss in women over 70 with prescription drugs had little to no impact on preventing future fractures. In fact, the side effects of these medications, including osteonecrosis of the jaw, esophageal damage, and atypical femur fractures, can be far more dangerous than the bone thinning itself. What doctors often don't mention: low bone density doesn't always mean high fracture risk. Bone quality, muscle strength, balance, and fall frequency matter just as much, if not more, than a scan result. Most fractures in older adults occur from falls, not from silently deteriorating bones. Many seniors are labeled as high risk and placed on medications for life, when no treatment was needed in the first place. A smarter, safer approach for older Americans. If you're over 70, haven't experienced fractures, and don't have a high fall risk, it's time to rethink routine DEXA scans. Rather than relying on a test that may do more harm than good, focus on natural, evidence-based strategies to strengthen your bones and prevent injury. Incorporate weight-bearing and resistance exercises, e.g., walking, yoga, light strength training. Get enough vitamin D and calcium through food and supplementation as needed. Practice balance and mobility training to reduce your fall risk. Stay physically active and maintain a healthy body weight. Before agreeing to a bone density scan, ask your doctor, will this change how we treat my health, or just lead to unnecessary medication? The bottom line for seniors: not every scan leads to better health, especially after 70. In many cases, routine DEXA scans in non-fragile older adults lead to overtreatment, fear, and unnecessary medication. If you're not actively falling or suffering fractures, there's a good chance you're better off focusing on lifestyle-based bone health strategies rather than pharmacological solutions. Talk to your doctor about whether this scan is truly needed, or whether it's just part of a one-size-fits-all approach that may no longer serve you. Final: why Americans over 70 should rethink routine medical screenings. Modern medicine has significantly improved life expectancy in the United States, but for older adults, particularly those aged 70 and above, more testing isn't always better medicine. In fact, overscreening can sometimes lead to unnecessary anxiety, risky procedures, and lower quality of life. That's why it's essential for American seniors, and their families, to shift from automatic checkups to individualized, evidence-based care. Before agreeing to any preventive test, ask your doctor. What exactly is this test screening for? Is there a real chance it will find something that can be treated effectively at my age? What are the potential harms of the test? Radiation, sedation, false positives, complications. If an abnormality is found, will the next steps improve my quality of life, or just lead to more testing and worry? Too often, older Americans are sent down a diagnostic rabbit hole. One test leads to another, followed by invasive treatments, even when the initial findings weren't dangerous to begin with. This approach not only inflates healthcare costs, it can also cause physical and emotional harm, especially when test results are ambiguous or misleading in older populations. It's time to put your health goals first. If you or someone you care about is over 70 and generally in good health, don't assume routine screenings are still necessary. Medical guidelines change with age, and what made sense in your 50s may no longer offer benefits in your 70s or 80s. Instead, talk to your primary care physician or geriatric specialist about your current health status and risk factors, the expected benefits versus risks of any proposed test, less invasive, safer alternatives to traditional screenings, your personal values and goals for aging. Personalized care, not a one-size-fits-all checklist, is the cornerstone of smart, safe aging. Stay informed. Stay in control. At a time when the healthcare system often prioritizes procedures over people, knowledge is your best defense. Making informed medical decisions doesn't mean ignoring your health, it means focusing on what truly matters to your well-being, independence, and peace of mind. If you're an American senior, or caring for one, subscribe to our free weekly newsletter for science-backed advice tailored to older adults, expert insights on when to say yes or no to testing, practical tips for navigating aging with clarity and confidence. Don't let outdated routines dictate your healthcare. Take control, ask questions, and choose a path that supports your values, not just your vitals. Over 50. Try this simple seed for natural retina support. Senior health tips. Healthy after 50. Are vision problems really inevitable after 50? For millions of Americans over 50, eyesight challenges feel like an unavoidable part of aging. Blurred vision, night blindness, difficulty reading fine print, and constant eye strain are often brushed off as just getting older. But modern research challenges this idea. Scientists now believe that some age-related vision decline may not be purely genetic or irreversible. Instead, it can be influenced by diet, inflammation levels, oxidative stress, and nutrient deficiencies, all factors that can be addressed with the right nutritional support. And here's the best part. You may already have one of the most powerful vision-supporting tools sitting right in your kitchen pantry. Why this matters for Americans over 50. Vision health is more than just clarity of sight, it's directly connected to quality of life, independence, and even emotional well-being. Age-related macular degeneration. This serious retinal condition impacts 1 in 10 Americans over 50, making it one of the most common causes of vision loss in seniors. A leading cause of blindness in adults, especially among people with type 2 diabetes, which is increasingly common after 50. Glaucoma. Often called the silent thief of sight, this condition affects millions of Americans and can progress without early symptoms. And vision loss doesn't just affect reading or driving. Seniors with poor eyesight are at a higher risk of falls, fractures, depression, and loss of independence. Studies show that vision-related mobility problems often lead to reduced physical activity, which in turn impacts cardiovascular health, weight management, and mental wellness. What science is revealing. Emerging research shows that certain nutrients found in common seeds, such as sunflower, pumpkin, chia, flax, and others, can provide natural, food-based support for retinal and overall eye health. Here's why they matter. Antioxidants for retinal protection. The retina is one of the most metabolically active tissues in the body, which means it constantly uses oxygen and produces free radicals. Over time, oxidative stress damages retinal cells, contributing to conditions like AMD. Antioxidants such as vitamin E, lutein, and zeaxanthin, found in seeds like sunflower and chia, help neutralize these free radicals. Omega-3 fatty acids to reduce inflammation. Chronic, low-grade inflammation is increasingly recognized as a key driver of age-related eye problems. Seeds like chia, flax, and hemp are rich in plant-based omega-3s, which may help reduce inflammatory damage to both the retina and optic nerve. Zinc for visual function. Zinc plays a critical role in transporting vitamin A to the retina, which supports night vision and visual clarity. Pumpkin seeds are a natural source of zinc, and studies show that seniors often have declining zinc levels due to reduced absorption with age. Improved circulation for eye tissues. Proper blood flow is essential for delivering oxygen and nutrients to the retina. Seeds such as black sesame and grape seeds contain compounds that may help support microcirculation, which is crucial for maintaining healthy retinal cells. What this means for you. If you're over 60, you don't have to simply accept vision decline as an inevitable part of aging. Adding a handful of nutrient-rich seeds to your daily diet may help protect your eyes naturally. While these foods aren't a cure or a replacement for professional eye care, they can be an easy, affordable, and science-backed way to support long-term vision health. For best result, be consistent. Nutrients take time to build up in eye tissues. Think weeks or months of daily use, not quick fixes. Combine different seeds. Each seed offers unique nutrients. A mix provides broader protection. Pair with an overall healthy lifestyle, regular exercise, good sleep, and annual eye exams remain essential. Key takeaway for seniors. Your eyesight plays a huge role in staying independent, active, and connected to the world around you. The good news: research shows you may have more control than you think. Start small. Sprinkle pumpkin or sunflower seeds on salads, blend chia or flax into your morning smoothie, or keep a bag of roasted seeds in your pantry for a daily snack. Over time, these simple habits can help nourish your retina, support your macula, and protect your vision as you age. Taking care of your eyes isn't just about seeing better, it's about preserving your freedom, mobility, and quality of life well into your 70s, 80s, and beyond. 8 seeds that may boost senior vision health. Sunflower seeds, a natural ally for aging eyes. If you are over 50 and starting to notice changes in your vision, such as blurry eyesight, eye fatigue, or increased sensitivity to bright light, adding sunflower seeds to your diet could be a simple yet powerful step toward protecting your eyes. Why vitamin E matters for senior vision. Sunflower seeds are one of the richest natural sources of vitamin E, a fat-soluble antioxidant that plays a crucial role in eye health. The retina, the thin, light-sensitive layer at the back of your eye, is one of the most metabolically active tissues in the entire body. Because it is constantly processing light and visual information, it is highly vulnerable to oxidative stress caused by free radicals. As we age, the body's natural antioxidant defenses weaken, making the eyes more susceptible to cellular damage. Over time, oxidative stress may contribute to age-related macular degeneration, cataracts, and other common vision problems in older adults. Vitamin E acts as a protective barrier by neutralizing free radicals before they can harm delicate retinal tissues. How much vitamin E do sunflower seeds provide? Just 1 ounce of sunflower seeds provides approximately 7.4 milligrams of vitamin E, a significant portion of the recommended daily intake for adults. Unlike synthetic supplements, the vitamin E found in sunflower seeds exists in multiple natural forms, each offering unique antioxidant benefits. Research published in Ophthalmology Journal suggests that people with higher vitamin E intake may have healthier retinal function and slower progression of age-related eye changes. Additional health benefits for adults over 50. While sunflower seeds are best known for their vision benefits, they also healthy fats that support overall cardiovascular health, a critical factor for maintaining good blood flow to the eyes. Magnesium and selenium, minerals linked to reduced inflammation, which may indirectly benefit ocular health. Plant-based protein to help maintain muscle mass, which is essential for staying active and independent as you age. Easy ways to add sunflower seeds to your diet. Sunflower seeds are versatile, making them easy to include in a senior-friendly, eye-healthy diet. As a snack, eat them roasted or raw for a quick, nutrient-packed energy boost. On salads, sprinkle them over leafy greens for extra crunch and nutrition. In yogurt or oatmeal, mix them into breakfast for a satisfying texture and added antioxidants. In homemade trail mix, combine with nuts and dried fruit for a portable, healthy snack. The bottom line for Americans over 50: protecting your vision doesn't always require expensive supplements or complicated routines. Something as simple as eating a handful of sunflower seeds a few times a week may help support your retina, reduce oxidative stress, and keep your eyes healthier as you age. Combined with regular eye exams and a balanced lifestyle, this small dietary change could be a valuable step in maintaining sharp, clear vision well into your senior years. Pumpkin seeds, a zinc-packed superfood for aging eyes. When it comes to protecting your vision as you age, pumpkin seeds deserve a place in your daily diet. Rich in bioavailable zinc, These small but mighty seeds deliver one of the most important minerals for senior eye health. Why zinc matters for eye health after 50. Zinc plays a critical role in transporting vitamin A to the retina, the part of your eye responsible for processing light and sending visual signals to the brain. Without adequate zinc, vitamin A can't do its job effectively, which may lead to night blindness, poor visual adaptation to darkness, and overall reduced retinal function. The retina naturally contains high concentrations of zinc, particularly in the macula, the area responsible for sharp central vision. However, as we age, zinc levels in the body may decline due to decreased absorption, dietary changes, or certain medication, making zinc-rich foods increasingly important for seniors. Pumpkin seeds. A natural zinc powerhouse. A single ounce of pumpkin seeds provides approximately 2 to 2.2 milligrams of zinc, delivered in a form that is highly absorbable by the body. Zinc from food sources like pumpkin seeds is often better tolerated and utilized compared to synthetic supplements. Zinc also acts as a cofactor for antioxidant enzymes, helping neutralize free radicals and reduce oxidative stress in delicate eye tissues. This antioxidant support is crucial for aging eyes, as oxidative damage is a known factor in conditions like age-related macular degeneration and retinal cell damage. Additional benefits for seniors. Beyond zinc, pumpkin seeds contain other nutrients that indirectly benefit eye health. Healthy fats that support cell membrane integrity, including those in retinal cells. Plant-based antioxidants that may offer mild anti-inflammatory effects. Magnesium and iron, which contribute to overall circulatory and nerve health, both essential for optimal eye function. How to add pumpkin seeds to your diet. For Americans over 50, the goal is consistent, daily intake. Here are simple ways to include them. Eat roasted pumpkin seeds as a convenient snack. Sprinkle them over salads, soups, or oatmeal for extra crunch and nutrition. Add them to homemade trail mix with other vision-supporting seeds like sunflower or chia. Blend them into smoothies for a nutrient-rich boost. For best results, choose unsalted and minimally processed pumpkin seeds to avoid unnecessary sodium and preservatives. Bottom line: if you're over 50 and concerned about your vision, pumpkin seeds are a simple, affordable, and natural way to support your eye health. By supplying zinc in a highly bioavailable form, they help deliver vitamin A to the retina, protect against oxidative stress, and maintain healthy visual function, all critical for staying independent and enjoying clear sight. Chia seeds, a simple superfood for protecting aging eyes. If you're over 50 and spending more time in front of screens, or just noticing changes in your vision, chia seeds may be one of the easiest ways to nourish your eyes naturally. This tiny seed, long celebrated for its heart and digestive benefits, is now gaining attention for its potential role in supporting senior eye health. Why chia seeds matter for eye health after 50. As we age, the eyes become more vulnerable to oxidative stress, inflammation, and cumulative light exposure. The macula, the part of the retina responsible for sharp central vision, is especially sensitive to damage from blue light emitted by phones, tablets, computers, and LED lighting. Chia seeds provide two key nutrients that directly target these. Omega-3 alpha-linolenic acid. Chia seeds are one of the richest plant-based sources of omega-3 ALA, which the body can convert, in small amounts, into EPA and DHA, fats known to support overall eye health. Omega-3s help maintain healthy cell membranes in the retina and may reduce inflammation linked to age-related vision problems, such as dry eyes or even early macular changes. Lutein and zeaxanthin, natural blue light filters. These carotenoids are often called macular pigments because they naturally accumulate in the macula. Their role: acting as internal sunglasses, filtering high-energy blue light that can stress and damage sensitive retinal cells over time. Consuming foods rich in lutein and zeaxanthin has been associated with better macular pigment density, which may lower the risk of age-related macular degeneration, one of the leading causes of vision loss in older Americans. Additional eye-friendly benefits. Chia seeds also provide vitamin E and polyphenol, which help neutralize free radicals that contribute to retinal aging. Improved circulation. Omega-3s in chia may support healthy blood flow to the retina, ensuring a steady supply of oxygen and nutrients, critical for maintaining clear vision. How to add chia seeds to your diet. Chia seeds are virtually tasteless, making them incredibly easy to include in your daily meals. Add to smoothies or protein shakes for a nutrient boost. Stir into oatmeal or yogurt for a creamy, pudding-like texture. Sprinkle on salads or roasted vegetables for a mild crunch. Make chia pudding by soaking them overnight in milk or a plant-based alternative, perfect as a breakfast or snack. Start with 1 to 2 tablespoons daily, and drink plenty of water, as chia absorbs liquid and expands into a gel-like consistency. The bottom line. For Americans over 50 looking for natural, food-based strategies to maintain eye health, chia seeds are a smart, science-backed choice. With their omega-3 ALA, lutein, and zeaxanthin, they help protect the macula, filter harmful blue light, and fight inflammation. Key factors in keeping your vision sharp as you age. Including chia seeds consistently over time, alongside other nutrient-rich foods, may help support the long-term health of your eyes and preserve the independence and quality of life that clear vision provides. Flax seeds, a natural solution for dry eyes after 50. If you are over 50 and struggling with dry, irritated eyes, adding flax seeds to your diet could be a simple, natural way to find relief. Aging, hormonal changes, certain medications, and even spending long hours in front of screens can all contribute to dry eye syndrome. Fortunately, flax seeds are packed with key nutrients that may help support eye comfort and protect vision as you age. Why flax seeds matter for eye health? Flax seeds are one of the richest plant-based sources of alpha-linolenic acid, a type of omega-3 fatty acid. Omega-3s play an essential role in controlling inflammation throughout the body, including in the delicate tissues of your eyes. For seniors, this is important because chronic low-level inflammation can reduce the stability of the tear film, which is responsible for keeping your eyes moist and comfortable. Flax seeds also contain lignans, powerful plant-based antioxidants that may help protect eye tissues from oxidative stress. Oxidative stress is one of the underlying factors in age-related eye changes, as free radicals gradually damage cells in the retina and other parts of the eye. How flax seeds may help with dry eyes. Dry eye syndrome happens when your tears either evaporate too quickly or don't contain enough of the right balance of water and mucus. This imbalance can make your eyes feel gritty, irritated, or fatigued, especially after reading or using digital devices. Research suggests that ALA from flax seeds may help by reducing inflammation. Omega-3 fatty acids are converted into compounds that help calm inflammatory responses in tear glands and surrounding tissues. Improving tear quality. Better control of inflammation may help your tear film stay stable for longer, keeping eyes lubricated and reducing that burning, scratchy sensation. Supporting healthy oil glands. The meibomian glands in your eyelids produce an oily layer that prevents tears from evaporating too quickly. Omega-3s may help these glands function more efficiently. Why you should always grind flax seeds. Whole flax seeds often pass through the digestive system without breaking down completely, meaning you might miss out on most of their nutrients. Grinding flax seeds before eating them ensures your body can absorb the ALA and lignans effectively. You can purchase ground flax seeds, sometimes labeled as flax meal, or grind them at home with a coffee grinder or blender. Easy ways to add flax seeds to your diet. Incorporating ground flax seeds into your daily routine is simple and inexpensive. Try these senior-friendly options. Sprinkle over oatmeal or yogurt for a mild nutty flavor. Blend into smoothies for an omega-3 boost. Mix into baked goods like muffins or whole grain pancakes. Stir into soups or stews to add fiber and nutrients without altering the taste much. Aim for 1 to 2 tablespoons of ground flax seeds daily for general health benefit. However, if you have a medical condition or are taking blood-thinning medications, check with your healthcare provider before making significant dietary changes. Supporting eye health naturally. While flax seeds alone won't cure dry eyes, they can be an important part of a holistic approach to eye health after 50. Combine them with other healthy habits. Stay hydrated throughout the day. Limit screen time or follow the 20-20-20 rule. Look 20 feet away every 20 minutes for 20 seconds. Wear sunglasses to protect from UV damage. Schedule regular eye exams to monitor age-related changes. Adding ground flax seeds to your diet is an easy, natural, and affordable step to support healthy, comfortable eyes as you age. With consistent use, you may notice less irritation, better eye moisture, and improved overall comfort. Black sesame seeds, a circulation-boosting superfood for aging eyes. When it comes to protecting your eyesight after 50, circulation matters more than you might think. Your retina, the light-sensitive tissue at the back of the eye, relies on a constant flow of oxygen and nutrients delivered through some of the smallest and most delicate blood vessels in your body. As we age, these vessels can become less flexible and more vulnerable to oxidative stress, making proper blood flow a top priority for maintaining sharp vision and healthy retinas. Why black sesame seeds matter for eye health. Black sesame seeds are a nutritional powerhouse, rich in lignans, thiamine, vitamin B1, and magnesium, 3 key nutrients that may help keep your eyes' circulation strong. Lignans for vascular protection. Black sesame seeds are loaded with plant-based lignans such as sesamin and sesamolin, compounds that research suggests may help combat oxidative stress in blood vessels. By neutralizing free radicals, these lignans may protect the delicate capillaries in your retina, helping them stay resilient as you age. Thiamine for nerve and visual function. Thiamine, or vitamin B1, supports nerve function, which is essential for the optic nerve, the highway that carries visual information from your eyes to your brain. Good circulation combined with strong nerve health may reduce the risk of age-related vision decline. Magnesium for healthy blood flow. Magnesium plays a crucial role in relaxing and widening blood vessels, which helps maintain smooth circulation. For seniors, optimal magnesium levels may help counteract the stiffening of blood vessels that often comes with aging. The connection between circulation and vision after 50. Poor microcirculation is one of the hidden factors behind many age-related eye problems, including macular degeneration and glaucoma. Healthy, flexible blood vessels ensure that your retina gets the nutrients it needs to function properly. Incorporating black sesame seeds into your diet may be a simple way to give your eyes natural circulatory support. How to add black sesame seeds to your diet. One of the best things about black sesame seeds is their versatility. Their rich, slightly nutty flavor pairs well with both sweet and savory dishes. Here are a few easy ways to enjoy them. Sprinkle them on salads, roasted vegetables, or grain bowls. Blend them into smoothies for a subtle nutty taste. Use black sesame tahini as a spread or dip. Mix them into oatmeal or yogurt for a nutrient-packed breakfast. For better nutrient absorption, lightly toast or grind the seeds before eating. The bottom line: if you're over 50 and serious about protecting your vision, don't overlook the role of circulation in eye health. Black sesame seeds, with their unique combination of lignans, thiamine, and magnesium, may help keep your blood vessels flexible and your eyes nourished. Adding just a small handful to your daily routine could be an easy, natural way to support healthy vision as you age. Hemp seeds, a natural ally for optic nerve health and aging eyes. As we age, the health of our eyes, especially the optic nerve, becomes increasingly important. For Americans over 50, age-related changes in vision can be linked to inflammation, reduced blood flow, and declining tissue resilience. Emerging research suggests that hemp seeds may offer a unique combination of nutrients that support optic nerve health, protect delicate eye tissues, and contribute to overall wellness. Why the optic nerve matters after 50. The optic nerve is like a high-speed cable, carrying visual information from your retina to your brain. Over time, this nerve can be affected. Chronic low-level inflammation, which may damage nerve fibers. Reduced blood flow, a common age-related change in circulation. Oxidative stress, which weakens nerve tissue and surrounding structures. Supporting this vital pathway with proper nutrition becomes critical for maintaining clear vision, depth perception, and overall eye comfort as we age. The nutritional power of hemp seeds. Hemp seeds stand out because they provide a unique balance of anti-inflammatory and tissue-supporting 1. Gamma-linolenic acid, omega-6 fatty acid. Unlike most omega-6 fats, which can trigger inflammation, GLA has anti-inflammatory properties. This makes it especially valuable for aging eyes where inflammation plays a key role in optic nerve stress. Research suggests GLA may help regulate inflammatory responses in nerve tissue, support healthy blood vessel function around the optic nerve, improve overall microcirculation, ensuring oxygen and nutrients reach eye tissues. Omega-3 fatty acids. Hemp seeds provide a favorable omega-3 to omega-6 ratio. Omega-3s are known for their role in protecting nerve cell membranes from oxidative stress, supporting the production of anti-inflammatory compounds in the body, potentially improving tear quality and eye comfort, which often decline with age. Complete plant-based protein. Hemp seeds contain all essential amino acids, which are building blocks for tissue repair and maintenance. This is crucial for seniors, as protein intake supports regeneration of eye tissues, including the delicate structures around the optic nerve. Muscle and vascular health, indirectly supporting circulation to the eyes. How to add hemp seeds to your daily routine. For adults over 50, consistency matters. Nutrients from hemp seeds accumulate over time, so regular consumption is key. Here are simple, senior-friendly ideas. Sprinkle them on salads or steamed vegetables for a mild, nutty flavor. Blend into smoothies or protein shakes for an easy nutrient boost. Add to oatmeal or Greek yogurt for a balanced breakfast. Use as a topping for soups or grain bowls to increase healthy fats and protein. A typical serving size is about 2 to 3 tablespoons per day, which provides a significant amount of GLA, omega-3s, and protein. Why hemp seeds belong in a senior-friendly eye health plan. For Americans in their 50s, 60s, and beyond, eye health is more than just seeing clearly, it's about maintaining independence and quality of life. By adding hemp seeds to your diet, you're taking a proactive step, reducing age-related optic nerve stress, supporting healthy blood flow and nerve communication, providing your body with the building blocks it needs to maintain strong, resilient tissues. Combine hemp seeds with other eye-healthy foods like sunflower seeds, pumpkin seeds, and leafy greens, and you may help protect your vision naturally. Grape seeds, a powerful ally for aging eyes. As we age, one of the most overlooked aspects of eye health is the integrity of the tiny blood vessels, or microvessels, that nourish the retina. These microscopic vessels play a crucial role in delivering oxygen and nutrients to the light-sensitive tissues responsible for clear, sharp vision. When they weaken or become damaged, vision problems can accelerate, contributing to age-related conditions such as macular degeneration or diabetic retinopathy. Why grape seeds matter for seniors over 50. Grape seeds, and particularly grape seed extract, are rich in proanthocyanidins and resveratrol, two powerful antioxidant compounds. These antioxidants may help protect the delicate microvascular network of the eye by combating oxidative stress, a process where free radicals damage cells, including those in the retina and supporting blood vessels. For adults over 50, oxidative stress tends to increase naturally due to aging, cumulative UV light exposure, and lifestyle factors such as high-sugar diets or smoking. Supporting vascular health with antioxidant-rich foods like grape seeds may help counteract some of this damage. The microvessel protectors. Proanthocyanidins are plant-based antioxidants with a unique ability to support vascular elasticity and strengthen the walls of small blood vessels. Preliminary research suggests they may help maintain capillary strength by stabilizing collagen and elastin, two proteins critical for blood vessel flexibility. Protect against oxidative damage that can stiffen or weaken tiny retinal vessels. Support circulation by promoting healthier blood flow to nutrient-hungry eye tissues. While these benefits have been studied extensively for general cardiovascular health, researchers are beginning to explore their potential for eye-specific microcirculation. Resveratrol, a well-known anti-aging compound. Resveratrol, another potent antioxidant in grape seeds, is already well known for its potential anti-aging effects. It may support healthy inflammation responses in blood vessels, reducing stress on sensitive eye tissues. Neuroprotective benefits, which could theoretically help safeguard the optic nerve over time. Though resveratrol is often associated with red wine, grape seeds and grape seed extract offer a concentrated, alcohol-free source of this beneficial compound. What research says, and what it doesn't. While cardiovascular and skin health benefits of grape seed extract are better documented, direct clinical research on eye health is still limited. Most existing evidence is based on how proanthocyanidins and resveratrol affect blood vessels in general. However, because the eye's microvessels are among the smallest and most delicate in the body, maintaining their structural health is considered essential for aging vision. How to incorporate grape seeds into your routine. Grape seed extract supplements. The easiest way to benefit from these compounds, as eating whole grape seeds is not practical for most people. Look for standardized extracts with high levels of proanthocyanidins. Grape seed oil can be used for cooking or salad dressings, though its antioxidant content is lower than concentrated extracts. Whole grapes. Some people consume ground grape seeds mixed into smoothies or yogurt, but they have a bitter taste and may be harder to digest. Important considerations for seniors. Before adding grape seed extract or supplements to your routine, consult your doctor, especially if you take blood thinners, blood pressure medication, or have a history of bleeding disorders, as grape seed compounds may affect circulation. Consistency matters. Like most nutritional approaches, benefits, if any, are gradual and may require weeks or months of regular use. Combine with other eye-healthy foods. Grape seeds work best as part of a holistic, nutrient-rich diet that includes omega-3s, vitamin E, and carotenoids. Bottom line: For Americans over 50, protecting eye health means going beyond symptom management and supporting the vascular foundation of vision. While more eye-specific studies are needed, the antioxidant power of grape seed extract makes it a promising addition to a vision-supportive diet. By strengthening microvessels and fighting oxidative stress, grape seeds may help maintain clearer, sharper vision well into your later years. Fennel seeds, a natural remedy for eye comfort after 50. For many seniors, maintaining eye comfort and reducing strain become daily priorities as vision changes with age. Fennel seeds have long been valued in traditional medicine for their potential to support eye health, offering a natural and accessible way to help ease eye discomfort and promote clearer vision. What are fennel seeds? Fennel seeds come from the fennel plant, a flowering herb commonly used in cooking and herbal remedies. They have a distinctive, slightly sweet and licorice-like flavor that many people find pleasant. Beyond their culinary uses, fennel seeds contain a rich variety of bioactive compounds, including flavonoids, essential oils, and vitamins. Key nutrients in fennel seeds that support eye health. Flavonoids, especially quercetin. Flavonoids are powerful plant-based antioxidants. Quercetin, one of the primary flavonoids found in fennel seeds, has been extensively studied for its ability to reduce inflammation and oxidative stress, two key contributors to age-related eye strain and discomfort. Oxidative stress damages delicate eye tissues by increasing free radicals, molecules that can harm cells and accelerate degeneration. Antioxidants. The antioxidants in fennel seeds help neutralize free radicals that build up in the eyes due to environmental factors like sunlight exposure, screen time, and pollution. By reducing oxidative damage, these antioxidants may support long-term eye health. Anti-inflammatory properties. Inflammation in the eyes can cause redness, irritation, and blurred vision. The anti-inflammatory compounds in fennel seeds may soothe irritated tissues, potentially easing symptoms related to eye strain, a common concern for adults over 50. Vitamin C and essential oils. Fennel seeds also contain vitamin C, an important nutrient for maintaining healthy blood vessels in the eyes, and essential oils that may contribute to their traditional use in supporting comfortable vision. How fennel seeds may help seniors with eye strain. As we age, it's common to experience symptoms like tired, dry, or strained eyes, especially for those who spend significant time reading, using digital devices, or working under artificial lighting. Incorporating fennel seeds into your diet or daily routine may provide relief by reducing oxidative stress and inflammation, helping protect delicate eye tissues from damage that contributes to discomfort and vision decline. Supporting blood flow. By maintaining healthy blood vessels, fennel seeds may aid nutrient delivery and waste removal in eye tissues. Promoting natural eye comfort. Their soothing properties have made fennel seeds a traditional go-to for eye-related discomfort in many cultures. How to incorporate fennel seeds into your routine. Fennel seeds are versatile and easy to use. Here are some simple ways seniors can enjoy their fennel tea. Steeping fennel seeds in hot water creates a fragrant, soothing tea. Drinking fennel tea regularly may help provide antioxidant support and calm eye strain. Chewing seeds. Some people chew fennel seeds directly as a natural breath freshener and to gain their health benefits. In cooking, ground or whole fennel seeds can be added to soups, stews, salads, and baked goods for a flavorful boost and healthful properties. Important considerations for seniors. While fennel seeds are generally safe for most people, seniors should consult with a healthcare provider before adding large amounts of fennel seeds or supplements to their diet, especially if they on medications or have underlying health condition. Understand that fennel seeds should complement, not replace, regular eye care, including routine exams and any prescribed treatments. Use fennel seeds consistently over time to allow their beneficial compounds to accumulate and potentially support eye health. Final thoughts. Fennel seeds represent a natural, affordable, and tested option to help ease eye strain and support comfortable vision for adults over 50. Their blend of flavonoids, antioxidants, and anti-inflammatory compounds may make a meaningful difference in how your eyes feel each day, especially in our modern world of increased screen use and environmental stressors. By thoughtfully incorporating fennel seeds into your diet alongside a healthy lifestyle and regular eye care, you can take proactive steps toward preserving your eye comfort and vision clarity well into your senior years. No single seed is a cure-all. Use a mix for balanced nutrients. Consistency is key. Daily intake over weeks or months allows nutrients to build up in eye tissues. Mix seeds into oatmeal, yogurt, salads, smoothies, or enjoy roasted/snacked options. Lifestyle tips to support vision. Maintain regular exercise. quality sleep, and shade from UV light. Visit an eye care provider regularly. These seeds are not a replacement for professional care. Discuss dietary changes with your healthcare provider, especially if you take medications or have health condition. Your vision has carried you through life's journey. While age-related decline is common, including these 8 accessible, affordable seeds in your diet may nourish your eyes from the inside out. Men over 60, 10 critical mistakes to avoid before getting a blood test. Marcus Wells, board-certified physician helping Americans 60+ protect their health and live fully. If you're over 60, chances are your doctor has recommended routine blood work, whether it's to monitor cholesterol, blood sugar, kidney function, or hormone levels. And while many people assume a blood test is a simple process, just head to the lab, roll up your sleeve, and check it off your list, the reality is a bit more complex. What most people don't realize, especially those in their 60s and beyond, is that what you do before your blood test can significantly affect the result. That cup of coffee in the morning, it could raise your blood sugar. Skipping your regular blood pressure pill, that might throw off your cardiovascular readings. Taking your usual supplements, some of them can actually interfere with hormone or thyroid test results without you even realizing it. And when you're in your 60s, you don't want false readings leading to unnecessary stress, extra trips to the doctor, or even the wrong diagnosis. I've seen it happen far too often. Patients end up with abnormal lab values, only to find out later that their preparation was the problem, not their health. As a physician with over 25 years of experience, much of it working directly with older adults, I've walked thousands of Americans through the process of getting accurate and reliable lab work. And one thing is clear, being prepared makes all the difference. That's why in this article, I'm sharing the 10 most common, and most avoidable, mistakes people make before blood tests, especially those over the age of 60. These mistakes may seem small, but they can lead to delayed or incorrect diagnosis, repeat lab visits and additional costs, unnecessary medications or procedures, emotional stress and confusion for you and your family. The good news: every one of these issues can be prevented with the right information. Whether you're getting blood work for your annual physical, managing a chronic condition like diabetes or high blood pressure, or tracking the effects of a new medication, this guide will help you take control of your results and work smarter with your doctor, not harder. You've worked hard to get where you are in life. Don't let a simple oversight before your blood draw derail your care. Let's walk through each mistake together so you can feel confident, informed, and ready when it's time for your next lab appointment. Let's get started. Not fasting properly, and it's more than just no food. For many adults over 60, routine blood work becomes a regular part of managing health. Whether it's monitoring cholesterol, blood sugar, or kidney function, your doctor may ask you to fast before your test. But here's where many people, especially older adults, make a critical error. They misunderstand what fasting really means. Fasting isn't just about skipping breakfast or avoiding solid foods. In medical terms, fasting means you should consume nothing except plain, unflavored water for a specific number of hours, usually between 8 to 12, before your blood draw. That includes avoiding coffee, even black tea, including herbal and green, fruit juice or flavored water, milk or cream, even a splash, artificial sweeteners, chewing gum or mints. For those in their 60s and older, these small exceptions may seem harmless, but they're not. Even a tiny amount of flavor, sugar, or calories can alter your blood test results significantly. For example, drinking coffee with cream can cause a spike in blood glucose, insulin, and triglycerides, 3 key markers we use to screen for metabolic issues like prediabetes, type 2 diabetes, and high cholesterol. I'll never forget a patient in his late 60s who came in for a routine fasting blood test. He told me confidently that he hadn't eaten anything in 12 hours, but when I probed a little further, he casually mentioned drinking his usual morning cup of coffee, with just a touch of cream. His results showed elevated blood sugar, and we nearly diagnosed him with diabetes. In reality, it was the cream in the coffee that caused the spike, not a chronic condition. These kinds of misunderstandings are more common than you'd think, especially among older adults who've been having blood work for decades but were never clearly told what fasting truly involves. Misinterpreting the results can lead to unnecessary repeat testing, anxiety, and in some cases, the wrong treatment plan. If your doctor orders a test that requires fasting, especially lipid panels or advanced cholesterol profiles, a full 12-hour fast is often necessary. That means if your appointment is at 9 a.m., your last bite or sip, besides water, should be no later than 9 p.m. the night before. For older Americans, especially those managing multiple chronic conditions, clear communication is key. Always ask your healthcare provider these 3 questions before a fasting blood test. How many hours should I fast? Is water allowed? Should I continue taking my morning medication? Don't assume. Ask. The more precise you are with your preparation, the more accurate and useful your results will be, saving you time, worry, and potential complication. In your 60s and beyond, your health decisions carry even more weight. Getting your blood work done right the first time ensures your doctor has the right data to support you, not mislead you. It's a small but powerful step toward better, safer care. Fasting too long or skipping, a hidden risk for adults over 60. While most people understand they need to fast before certain blood tests, many take this instruction to the extreme, especially older adults who are trying to be cautious. I've had countless patients over 60 who thought, if 8 hours is good, 16 hours must be even better, or who skipped all their medications to avoid interfering with lab results. But here's the truth. Overfasting or skipping your regular medications can be dangerous, particularly as we age. Let's break it down. Overfasting isn't safer, it can be harmful. As we get older, our bodies don't regulate blood sugar as efficiently as they used to. For people with diabetes, especially those taking medications like glipizide, glyburide, or insulin, fasting longer than prescribed can cause hypoglycemia, or dangerously low blood sugar. This isn't just about feeling a little shaky. In adults over 60, hypoglycemia can result dizziness or confusion, loss of coordination, fainting or falling, which increases fracture risk, emergency hospitalization. Even if you're not diabetic, extended fasting can still affect your energy, balance, and cognitive sharpness, especially if you're taking multiple medications or dealing with age-related changes in metabolism. Skipping medications, just in case, can be even riskier. Some people worry that medications like blood pressure pills will skew test results, so they stop them without checking with their doctor. That decision can backfire quickly. Missing even one dose can cause your blood pressure to spike, putting you at risk for a heart attack or stroke. Seizure medications, suddenly stopping these, even for one morning, can increase your chances of having a seizure, especially if you've had one in the past. Thyroid medications, heart meds, or diuretics. Skipping these may not only impact your lab results but also destabilize your condition, particularly if you're being monitored for chronic disease. And let's not forget, Americans over 60 are often managing multiple chronic conditions at once. That means more medications, and more potential complications if you stop them abruptly. So, what should you do? The key is clarity, not guesswork. Before your scheduled blood test, talk with your doctor or pharmacist and ask these 3 questions. Do I need to fast for this test? If so, for how long? Should I take my morning medications as usual? Are there any medications or supplements I should skip temporarily? Your healthcare provider can tailor their advice based on health history, the medications you're on, the specific lab tests being performed. For example, if you're getting your blood sugar or lipid levels checked, you may need to fast, but should still take your blood pressure medication with a sip of water. In contrast, if you're having a thyroid panel done, fasting might not be necessary at all. Final thought. For older adults, especially those over 60, the goal is to prepare smart, not extreme. You don't need to overcompensate by fasting too long or stopping essential medication. In fact, doing so can put you at unnecessary risk. Always check with your healthcare provider in advance. A 5-minute phone call could prevent a fainting episode, a trip to the emergency room, or a misdiagnosis. Taking a cautious but informed approach ensures that your test results are accurate, and that your body stays safe in the process. Here's why it matters for adults over 60. Staying active is one of the best things you can do for your health, especially as you age. Regular physical activity supports heart health, bone density, mobility, mood, and energy levels well into your 60s and beyond. But when it comes to blood testing, timing your workouts matters more than you might think. Many older adults make the well-intentioned mistake of hitting the gym or going for a vigorous walk the morning of their blood draw, believing that exercise will only reflect positively on their health. Unfortunately, this can lead to misleading lab results, even if you feel perfectly fine. Let's break down why intense exercise right before a blood test can create problems. Temporary changes that skew your result. When you engage in high-intensity activities, such as weightlifting, resistance training, long-distance walking, or cycling, your body undergoes physiological changes that are completely normal. However, these changes can be misinterpreted when looking at blood work. Here are some of the key markers of creatine kinase. After strenuous exercise, your muscles release an enzyme called CK into your bloodstream. Elevated CK levels can resemble the pattern seen in actual muscle damage or inflammation, which may alarm your doctor unnecessarily. Creatinine. This waste product is filtered by your kidneys. After a workout, your creatinine levels may rise due to muscle breakdown, making it appear as though your kidneys aren't functioning as well as they actually are, especially concerning for those over 60, as kidney health is closely monitored in older adults. Liver enzymes. Physical exertion can also cause a spike in liver enzymes like AST and ALT. If these appear elevated, your doctor may suspect liver issues, prompting additional tests or even referrals to specialists. Blood glucose. Exercise increases the body's energy demands, which can temporarily elevate blood sugar levels. This can confuse your doctor if they're monitoring your glucose for prediabetes, diabetes, or insulin resistance, all of which are more common in people over 60. Why this is especially important for seniors. As we age, our bodies become more sensitive to metabolic shifts. Healthcare providers are often watching lab results more closely for signs of chronic conditions like diabetes, heart disease, kidney disease, and liver issue. Even a temporary change caused by exercise can raise unnecessary red flags, leading to repeat tests, anxiety, and potentially costly medical evaluations that could have been avoided. In fact, one of the most common reasons patients over 60 are asked to return for retesting is due to test results that were skewed by something they did, like working out, just hours before the blood draw. What you should do instead. To ensure your blood test results reflect your true baseline health, here's what I recommend. Avoid intense exercise for at least 24 hours before your blood test. This includes any activity that raises your heart rate significantly, causes muscle soreness, or involves weight resistance. Stick to light activity. If you need to move around or stretch, that's fine, just avoid anything that feels like a workout. Give your body time to rest. A day of recovery before your labs not only supports accurate readings but is also a healthy part of any fitness routine, especially for those over 60. Bottom line. While exercise is a powerful tool for aging well, timing is everything when you're getting your blood drawn. Let your body settle and recover before heading to the lab. It's one of the simplest ways to avoid confusion, retesting, and unnecessary concern, giving both you and your doctor the clearest possible picture of your health. Marcus Wells, board-certified physician helping Americans over 60 thrive. Not drinking enough water, a common yet costly oversight for adults over 60. As we get older, our bodies naturally undergo changes that can affect everything from metabolism to thirst perception. Many adults over 60 simply don't feel thirsty the way they used to, and that can become a real issue when it comes to preparing for blood work. Dehydration is one of the most common, and most overlooked, reasons for inaccurate or difficult lab results. And here's why it matters. Dehydration makes blood draws more difficult, especially for aging veins. If you're not well hydrated, your blood volume decreases slightly and your veins become less plump. This makes it significantly harder for the phlebotomist to locate a good vein, especially in older adults, whose skin may already be thinner and whose veins may be less elastic. Result: more pokes, more time in the chair, and often, more discomfort. Concentrated blood can distort key lab values. When you're dehydrated, your blood becomes more concentrated. That means the levels of substances in your blood, like creatinine, sodium, potassium, and urea nitrogen, may appear artificially elevated. For someone in their 60s or 70s, this can be especially misleading, as physicians may interpret these numbers as early signs of kidney dysfunction or electrolyte imbalance. That could trigger unnecessary follow-up tests, cause concern about conditions that aren't actually present, or even result in inappropriate medication adjustments. Hydration directly affects kidney function result. The kidneys are responsible for filtering waste and maintaining fluid and electrolyte balance in the body. When you're dehydrated, your kidneys have less fluid to work with, which can lead to a temporary dip in performance on your lab report. For seniors, where even slight changes in kidney function are monitored closely, this can raise false alarms. I've seen patients over 60 sent for additional nephrology consults or imaging studies based solely on labs that were skewed by nothing more than a lack of water intake. Aging decreases natural thirst, so you may not realize you're dehydrated. One important factor many people in their 60s and beyond don't realize is that the sensation of thirst becomes less reliable with age. You may not feel thirsty even when your body needs fluids. That's why it's important to make hydration a conscious habit, especially the day before and morning of your blood test. So, what should you do? Start hydrating the day before. Don't wait until the morning of your blood draw to start drinking water. Begin sipping water steadily throughout the previous day. Aim for around 6 to 8 cups unless your doctor has placed you on a fluid restriction. Drink a full glass of water 1 to 2 hours before your test. Even if you've been instructed to fast, water is usually allowed, and highly recommended. Only in very rare cases, such as before sedation or certain specialized tests, is water restricted. Double check with your doctor if you're unsure. If you've been told to fast, and you're not sure whether that includes water, call your doctor or the lab in advance. But for most standard blood tests, including cholesterol, glucose, kidney panels, and complete blood counts, water is not just allowed, it's encouraged. Final thoughts for adults 60+. In my experience as a physician caring for Americans over 60, hydration is one of the simplest ways to make your blood test more comfortable and more accurate. It's also one of the most overlooked. By staying properly hydrated before your blood work, you make the process easier for you and your care team. Improve the reliability of your test result. Reduce the chances of repeat testing or misinterpretation. It may seem like a small step, but for older adults, it's a powerful one. So next time you have a lab appointment, don't just fast. Hydrate smartly. Your body, and your doctor, will thank you. Avoid blood tests right after drinking alcohol or while you're sick. As someone over 60, you know how much your body changes with age. And that includes how your body processes things like alcohol and medication. That's why it's so important to time your blood tests wisely, because lab results are only helpful when they reflect your true, everyday state of health, not a temporary fluctuation. Why alcohol can mislead your lab result. Let's say you've just returned from a trip, maybe a long weekend with friends, a cruise, or a family celebration. You enjoyed a few drinks, maybe more than usual. That's completely normal and understandable. But, even a couple of nights of heavier than usual drinking can alter key lab markers for up to several days. Alcohol can falsely elevate liver enzymes. These are markers we use to assess liver function. Alcohol, especially in larger amounts, can temporarily cause them to spike, sometimes to levels that mimic liver damage. These blood fats can shoot up dramatically after drinking alcohol. This is especially important if your doctor is evaluating your heart disease risk or trying to manage your cholesterol. Blood sugar. Glucose. Alcohol can cause erratic blood sugar levels. It may raise your fasting glucose or even interfere with long-term markers like HbA1c in some cases. If you're not a regular drinker but just had a few drinks more than usual, these temporary shifts can be misleading. Your doctor might think something is seriously wrong, when in reality, your body is simply reacting to alcohol. For someone in their 60s, this matters even more. Liver function tends to slow with age, and older adults are more sensitive to the effects of alcohol. What you could handle at 40 might now cause more disruption than you expect. Illness can also throw off results. Consider you're recovering from a seasonal cold or a mild bout of bronchitis. You've been on antibiotics or over-the-counter medications, and you're not quite back to your normal routine. Maybe you haven't been eating well, your sleep is off, and your activity level has dropped. These factors, along with certain medications, can also cause changes in your lab result. Liver enzymes might rise due to medication metabolism. Kidney function might appear worse than it is due to dehydration. Inflammatory markers might be higher than usual as your immune system works to fight off illness. If you get your labs drawn during this period, your doctor might see values that don't reflect your normal health status and recommend unnecessary follow-up testing, or worse, adjust medications based on skewed results. What should you do instead? If your lab work isn't urgently needed, it's often best to wait until you've returned to your baseline, meaning you've had at least a few days of no alcohol. Full recovery from illness. A return to your usual eating, sleeping, and hydration habits. Of course, there are exceptions. If your doctor specifically ordered labs to evaluate how your body is responding to a medication, such as liver function tests while on statins or antifungal treatment, then the timing may be intentional. In those cases, follow your doctor's advice closely. But for routine blood panels, like cholesterol checks, liver enzymes, or blood sugar levels, timing is everything. A note for Americans 60 and older. As we age, our bodies take longer to bounce back. A weekend of indulgence or a week of illness can have a stronger and longer-lasting effect on our metabolism, our immune system, and our lab values. For that reason, older adults should be especially cautious about when to schedule routine blood work. The goal is to avoid false positives, unnecessary worry, repeat visits, and even inappropriate treatments. One of the best ways to do that is simply by giving your body time to reset before testing. Taking supplements that interfere with lab results, a hidden risk for older adults. If you're over 60 and working hard to maintain your health, chances are you're taking a few supplements, maybe even more than a few. But what most people don't realize, especially in their 60s and beyond, is that some of the most popular over-the-counter supplements can interfere with your blood test results, leading to confusion, unnecessary follow-ups, and even incorrect treatment adjustments. One of the most common culprits, biotin, also known as vitamin B7. Biotin is widely marketed for improving the health of your hair, skin, and nails, and it's found in countless supplements on pharmacy shelves across the US. It's especially popular among older adults looking to slow age-related changes in skin elasticity, nail brittleness, and thinning hair. But here's what you need to know. Biotin can interfere with certain blood tests, especially those related to your thyroid. Biotin itself isn't harmful. It doesn't damage your thyroid or your organs. But it interferes with the way laboratories measure key hormones, particularly TSH, the hormone your brain sends to your thyroid to regulate how fast your body burns energy. If you're taking biotin close to the time of your blood test, it can cause the lab equipment to underestimate your TSH levels. That means your test might show your thyroid is overactive, even if it's perfectly normal. For Americans in their 60s, this is especially important because many adults over 60 are being monitored for thyroid disease, which becomes more common with age. Misreading could prompt your doctor to lower your thyroid medication, even when it's not needed. Some people are wrongly referred to endocrinologists or ordered additional expensive testing, all because of inaccurate lab results caused by a supplement. Real-life example from my practice. I once saw a 62-year-old patient who had been feeling more tired than usual. Her labs came back showing low TSH, which typically signals an overactive thyroid. But when I asked about her medications and supplements, she casually mentioned she was taking a beauty blend that included 5,000 micrograms of biotin daily. We paused the supplement for several days, retested her labs, and, sure enough, her TSH was perfectly normal. No thyroid problem, no need for new medication, no need for an unnecessary referral. How to protect yourself. If you're taking any supplement that contains biotin, and this includes many popular anti-aging blends, multivitamins, and skin nail formulas, you need to stop taking it at least 2 to 3 days before your blood test. In some cases, especially with higher doses, your doctor may advise you to stop even earlier. Also, be sure to always tell your healthcare provider that you're taking biotin. This simple step can prevent misdiagnosis and save you time, stress, and money. Final thought for adults 60 and older. Many older adults are doing the right thing by investing in supplements to support aging gracefully. But unless you're aware of how those supplements can affect your lab work, you might unknowingly complicate your care. So if you're over 60 and getting ready for a routine blood panel, especially one that includes thyroid function tests, take a moment to review your supplements. Check for biotin, stop it in time, and inform your doctor. It's a small step that can make a big difference in ensuring your health decisions are based on accurate information, not distorted data. But what many people don't realize is that when you get those hormone tests matters just as much as what you're testing. Hormones don't stay the same throughout the day, they follow natural daily rhythms, and ignoring that timing can lead to false results, wrong diagnoses, or unnecessary treatments. Let's break it down. Testosterone, morning matters, especially for men over 60. For men, testosterone levels are usually highest in the early morning, typically between 7 a.m. and 10 a.m. After that, levels drop gradually throughout the day. If you're a man in your 60s or older and your testosterone is tested in the afternoon, you may see an artificially low number, even if your body is producing enough testosterone for your age group. That can lead to a diagnosis of low T when you may not truly have it, which in turn could lead to unnecessary treatments, including testosterone replacement therapy. Why does this matter? Testosterone therapy can have side effects, including increased red blood cell count, fluid retention, and risk of prostate enlargement. Many men are prescribed testosterone based on a single test done at the wrong time of day. Always schedule testosterone testing in the early morning, ideally before 10 a.m., and make sure you've had a good night's sleep. Your levels should be tested more than once before making any decisions about treatment. Cortisol, one hormone, two different testing goals. Cortisol, your primary stress hormone, is another hormone that fluctuates on a daily cycle. Its levels are highest in the morning and lowest around midnight, in people with a healthy circadian rhythm. But how we interpret cortisol results depends on what we're looking for. If we're testing for cortisol deficiency, for example, if your doctor suspects Addison's disease, then we want to test your cortisol early in the morning, usually around 8 a.m. If your levels are low when they should be high, that's a red flag. If we're testing for cortisol excess, like in Cushing syndrome, we want to test when cortisol is supposed to be at its lowest, at night. That's why a common test is the midnight salivary cortisol test, where you collect a saliva sample at home and mail it to the lab. Why sleep and routine matter. Here's something many older adults overlook. Your sleep habits directly influence hormone levels. If you were awake all night due to travel, shift work, insomnia, or stress, and then go for blood work at 8 a.m., your results might not be accurate. That's because sleep deprivation disrupts your body's internal clock, affecting cortisol and testosterone levels. The lab compares your results to standard ranges based on people who slept through the night. If you didn't, your levels may look off even when nothing is truly wrong. So, if you're planning to have hormone testing done, make sure you're well rested. Stick to your normal routine the night before. Let your doctor know if you had a poor night's sleep, traveled across time zones, or had unusual stress. For women over 60, timing can still play a role. Although postmenopausal women don't have the same monthly hormone fluctuations they did in earlier years, cortisol and thyroid hormones still follow a daily pattern. Poor sleep, illness, or testing at the wrong time can still interfere with accurate results and may influence decisions about thyroid management or adrenal support. Final takeaway. If you're in your 60s or beyond, getting your hormone levels tested at the right time of day is critical for getting the right answers and avoiding the wrong ones. Whether you're checking testosterone, cortisol, or other hormones, proper timing and sleep hygiene can help your doctor make informed decisions that truly reflect your health. Talk to your doctor before scheduling labs. What time of day should I get this test? Should I fast or not? Does sleep affect this test? Taking these small steps can mean the difference between an accurate diagnosis and months of chasing the wrong problem. Not telling your doctor about all medications and supplements. At your age, even small omissions can lead to big misunderstandings. Marcus Wells. If you're in your 60s or beyond, you've probably accumulated a long list of medications, vitamins, and supplements over the years. Maybe you're on a blood pressure pill prescribed a decade ago, a daily multivitamin, and recently started a supplement for joint support that your neighbor swears by. Or perhaps you joined a men's health clinic that prescribed testosterone injections or pellets to boost your energy. If your doctor doesn't know exactly what you're taking, they're working in the dark, and that can lead to serious consequences. Let me tell you about a patient I once saw. He was a 63-year-old man, active, healthy-looking, but his routine labs showed an unusually high red blood cell count. His primary care physician was worried. High red cells can be a red flag for rare and serious conditions like polycythemia vera, a bone marrow disorder. The doctor was preparing to refer him to a hematologist for a full workup. But when I sat down with him and asked a few extra questions, it came out that he had recently started receiving testosterone pellet therapy at a men's clinic. He didn't think it was important to mention. After all, it wasn't a prescription from his regular doctor. That missing piece changed everything. Testosterone therapy is a known cause of elevated red blood cell counts. It's not dangerous in itself when properly monitored, but if a doctor doesn't know you're taking it, they may misinterpret your labs, assume something seriously wrong, and send you down a path of anxiety, referrals, and expensive testing you didn't need. This issue is even more common now with the growth of telehealth services, online prescription programs, over-the-counter and herbal supplements, weight loss clinics, anti-aging and hormone therapy centers. Many of these services don't coordinate with your primary care doctor, and unless you tell your physician what you're using, it doesn't get documented in your medical record. Why it matters more after 60. As we age, our bodies metabolize medications differently. What was once a harmless supplement at 40 can start interacting with your heart meds or affect your liver enzymes at 65. Even something as natural as turmeric, fish oil, or magnesium can interfere with blood clotting, kidney labs, or thyroid testing. Doctors depend on a complete picture to interpret your test results accurately. That includes prescription medication, vitamins and minerals, Herbal or natural remedies. Hormonal therapies, like testosterone, thyroid extracts, injections, drops, pellets, creams, or patches, everything counts. And if you're not sure whether something matters, tell your doctor anyway. Let them decide. It's far better to overshare than to leave out something that could change the course of your care. What you can do today. Bring a full list to your appointments, include brand names, doses, and how often you take each item. If you use a pill organizer, snap a picture and show your doctor. If you started anything new from a clinic, over-the-counter store, or online pharmacy, let your doctor know. Be honest. You're not being judged, you're being protected. Being transparent with your care team isn't just about doing the right thing, it's about making sure your test results are read in context. Especially after 60, when you may be managing more than one condition at a time, the clarity you provide can be the difference between accurate care and unnecessary intervention. Better communication leads to better decisions, and better health. 9. Getting blood work too soon after changing medication. Why timing matters, especially after 60. If you're over 60 and managing chronic conditions like hypothyroidism, type 2 diabetes, or high blood pressure, chances are your doctor may occasionally adjust your medication. That could mean starting a new prescription or changing the dosage of something you've been taking for years. And while it's natural to want quick answers, to see if the new medication is working or causing side effects, testing your blood too early after a change can give you a misleading picture. Medications need time to take effect. Many medications, especially those that regulate hormones or blood sugar, work gradually. For example, thyroid medications like levothyroxine may take several weeks to fully normalize your TSH levels. Diabetes medications such as metformin or GLP-1 agonists require at least a few weeks to show meaningful changes in your A1C or fasting glucose. Even cholesterol medications like statins may not show full lipid changes until you've been on them for a month or more. Your body, especially after 60, doesn't always respond overnight. Metabolism tends to slow down, and organs like the liver and kidneys, which process most medications, may take longer to adjust. So testing just a few days, or even a week, after starting or changing a medication may result in labs that don't reflect the full therapeutic effect. This can confuse your doctor and lead to unnecessary changes in treatment or even additional testing you don't need. Why this matters for seniors. At age 60 and beyond, many Americans are managing multiple medications at once. If your doctor orders blood work too soon after a change, it may look like the new dose isn't working, when in reality, your body simply needs more time to respond. In some cases, your doctor may even think the medication is causing an adverse effect when it's just part of the normal adjustment period. This is particularly true for medications that affect thyroid hormones, free T4, blood sugar control, fasting glucose, insulin, kidney function, cholesterol and triglycerides, blood pressure medication. For older adults, interpreting lab values too early can cause overcorrection, medication fatigue, and even distrust in treatment, none of which serve your long-term health. How long should you wait? Unless your doctor has a specific reason to test earlier, for example, to check for side effects or monitor kidney safety, the general rule is wait 4 to 6 weeks after starting or adjusting thyroid or cholesterol medication. Wait at least 2 to 4 weeks for diabetes medications, depending on the drug. For blood pressure changes, your doctor may recommend checking blood pressure at home rather than rushing back to the lab. Always follow the specific timeline your doctor recommends. If you're unsure, ask, when should I get my labs done to make sure the medication has had time to work? Final thought. For Americans over 60, managing your health takes patience, and that includes being patient with your medication. The best way to get accurate, actionable lab results is to give your body the time it needs to adapt. That way, your care team can make informed decisions based on true, stable numbers, not premature snapshots. Your time is valuable. Your health is too. So let's get it right the first time. It's common to think you can wait until the very last minute to get your blood drawn before your doctor's visit, or even worse, to cancel or postpone your appointment if all your lab results haven't come back yet. This approach may seem convenient or less stressful at first, but it can actually cause delays in your diagnosis and treatment, and in some cases, even put your health at risk. Here's why this is an important issue. Lab processing times vary. Depending on the type of tests ordered, some results may take only a day or two, while others, like specialized hormone panels or genetic tests, might take longer. If you wait until just before your appointment to do your blood work, there's a good chance your doctor won't have all the information available during your visit. Partial results are still useful. Even if some lab results are pending, the tests that have come back might reveal critical information. For example, your doctor could detect early signs of kidney problems, anemia, infections, or abnormal blood sugar levels. Acting on these findings promptly can prevent complications, hospitalizations, or worsening symptoms. Delaying care can lead to worse outcomes. For seniors, timely diagnosis and management of chronic conditions like diabetes, hypertension, or heart disease can be life-saving. Skipping or postponing appointments because of incomplete lab results can delay important interventions, medication adjustments, or referrals to specialists. Your appointment is about more than labs. A doctor's visit isn't just about reviewing blood work. It's also an opportunity to discuss symptoms, medication side effects, lifestyle changes, and any new health concerns. Even without full lab data, your healthcare provider can help guide your care based on the information available. Plan ahead and communicate. To avoid last-minute stress, schedule your blood draw several days before your appointment. If you know certain tests will take longer, ask your provider about the best timing for labs and visits. If some results aren't back by your appointment, don't cancel, attend and discuss the next steps, including when to follow up. For Americans over 60, maintaining proactive communication with your healthcare team is essential. Managing your health is a partnership, and timely lab testing combined with regular doctor visits helps ensure you stay on track. Remember, your health can't wait. Don't let timing issues interfere with the care you deserve. Show up for your appointments, review what's available, and work with your doctor to schedule any necessary follow-ups. For Americans entering their 60s and beyond, blood tests are far more than just routine lab work. They provide a vital snapshot of your overall health and can guide important decisions about your medical care. At this stage of life, staying proactive with your health is crucial, and getting accurate blood test results is one of the most straightforward, yet powerful tools you have to monitor how your body is doing. The way you prepare for your blood test has a direct impact on the accuracy of the result. Simple missteps, like eating or drinking something you shouldn't, skipping medications without medical advice, or not telling your doctor about all the supplements and treatments you're using, can lead to false readings. This can delay diagnoses, result in unnecessary follow-up tests, or even lead to treatments that you don't really need. By consciously avoiding the 10 common mistakes we've discussed, you're not only saving yourself the inconvenience and anxiety of repeating blood tests, but you're also ensuring that your healthcare providers get reliable information. This empowers your doctor to make the best possible decisions tailored to your unique health needs. Whether it's managing chronic conditions like diabetes and heart disease, checking hormone levels, or monitoring kidney and liver function, accurate labs are the foundation for effective care. For those over 60, your body goes through changes that can affect test results. Metabolism slows, hormone levels fluctuate, and the way medications interact can be different than when you were younger. This makes it all the more important to follow preparation guidelines precisely and communicate openly with your healthcare team. If you found these insights helpful, I encourage you to share them with your family members, friends, or caregivers. These are the people who might also benefit from knowing how to approach blood tests correctly. And don't hesitate to bring up any questions you have at your next doctor's appointment. Being informed and involved in your healthcare is one of the best steps you can take toward maintaining your independence and quality of life. Remember, knowledge is powerful, but it's most powerful when paired with action. Taking these small, thoughtful steps before your blood test can make a big difference in keeping you healthy, active, and confident as you enjoy your years ahead. Stay well, stay informed, and stay proactive. Men over 60. Truth about fruit and male vitality after 60. What every man over 60 needs to know about testosterone, blood flow, and the fruits that can make or break your health. There's a fruit sitting quietly in your kitchen right now. You've probably eaten it for years without a second thought. It's marketed as heart healthy, praised for its antioxidants, and recommended by diet books. But here's the hard truth. For men over 60, this so-called healthy choice could be doing more harm than good. It might be draining your testosterone, clogging your blood vessels, and slowly stealing your sexual vitality. I'm Dr. Marcus Wells, and for more than 30 years, I've helped men in their 50s, 60s, and 70s reclaim their strength, confidence, and intimate vitality naturally. I've worked with thousands of patients across the United States, and I've seen something remarkable. When men stop guessing about nutrition and start eating with a purpose, their bodies respond faster than they ever imagined. even after 60. But here's the truth no one talks about. Not all fruits are good for aging men. Why some fruits are bad news for men over 60. You've been told that all fruit is healthy. That's simply not true, especially as you get older. Some fruits can increase estrogen levels, throwing off your hormonal balance and leading to lower testosterone, spike insulin, causing weight gain, sluggish metabolism, and energy crashes, suppress nitric oxide production, which is essential for firm, healthy erections and good blood flow. The result? Lower drive, weaker performance in the bedroom, and fading energy that makes you feel older than you really are. But here's the good news, the right fruits can do the opposite. They can restore healthy circulation, protect testosterone, reduce inflammation, and help you feel strong, energetic, and alive again, without relying on medication. The hidden testosterone trap. For decades, grapes have been marketed as a symbol of good health. They're small, sweet, and full of antioxidants, at least, that's what most men have been told. But for men over 60, especially those concerned about strength, energy, and sexual vitality, grapes can quietly sabotage your hormonal health in ways few people talk about. Why grapes can be a problem for aging men. The issue isn't just the fruit itself, it's how grapes are grown. Grapes are among the most heavily sprayed crops in American agriculture. Conventional grapes are coated with a chemical cocktail of pesticides, and many of these chemicals are classified as xenoestrogens. Xenoestrogens are synthetic compounds that mimic estrogen in the body. When you consume these chemicals over time, they interfere with your natural hormone balance by competing with testosterone. And for men over 60, who are already experiencing age-related declines in testosterone, even a small hormonal disruption can have noticeable consequences. What happens when xenoestrogens enter your system? In my clinical practice, I've seen firsthand how these estrogen-like compounds affect older men. Too much estrogen, even in small amounts, can lead lowered libido and weaker sex drive, belly fat accumulation, especially around the waistline, swollen prostate, which can lead to urinary problems and discomfort, softer, weaker erections due to disrupted nitric oxide production. This hormonal shift doesn't happen overnight, but it builds gradually, leaving many men wondering why they feel sluggish, less masculine, and disconnected from their intimate lives. A real case from my clinic. Take Alan, a 67-year-old patient who came to me frustrated about his low energy and fading bedroom performance. Like many men, he believed grapes were helping his blood pressure, so he ate 2 handfuls every single day. When we reviewed his diet, I recommended cutting out conventional grapes completely and replacing them with testosterone-friendly fruits like pomegranate and blueberries. Within just 3 weeks, Alan noticed significant changes. He woke up with firmer, stronger morning erections. His energy levels improved, and he felt more mentally alert. His confidence, in and out of the bedroom, started to return. The only change he made? He stopped eating grapes and gave his body a break from those estrogen-mimiccing chemicals. The problem with grape juice. If conventional grapes are bad, grape juice is even worse. Commercial grape juice is often loaded with sugar, and most store-bought brands are made from conventionally grown grapes, meaning you're drinking concentrated pesticides in every sip. High sugar intake also spikes insulin, which further suppresses testosterone. What you should do instead? Avoid conventional grapes whenever possible. If you love grapes, choose organic and eat them sparingly. Skip grape juice. There's no health benefit worth the hormonal cost. Focus on testosterone-friendly fruits. Pomegranate, kiwi, blueberries, and watermelon are much better choices for maintaining strong blood flow, stable hormones, and youthful energy. Bottom line for men over 60. Grapes might look harmless, but for older men, they can be a hidden testosterone trap. If you're serious about staying strong, lean, and confident after 60, you need to think beyond healthy marketing claims and focus on how foods affect your hormones. Your body still has the ability to feel alive and vigorous. You just need to give it the right support. Sometimes, the first step is as simple as removing one food you never realized was holding you back. 2. Canned fruit cocktails, the senior sweet trap that sabotages male health. For decades, canned fruit cocktails have been marketed as a convenient, healthy choice for seniors. They're neatly packaged, easy to chew, and often eaten with breakfast alongside morning medication. But here's the truth most men over 60 never hear. These colorful little fruit cups may be quietly destroying your energy, clogging your arteries, and draining your testosterone. The hidden danger in canned fruit cocktails. The problem isn't just the fruit, it's what that fruit is sitting in. Most canned fruit cocktails are soaked in high fructose corn syrup, or concentrated fruit juices, both of which are loaded with simple sugars. When you eat them first thing in the morning, these sugars flood your bloodstream almost instantly, causing 3 major health problems. Insulin spikes and testosterone drops. Elevated insulin lowers testosterone production. For men over 60, whose hormone levels are already declining, even small daily insulin surges can mean weaker erections, lower libido, and reduced muscle strength. Excess sugar irritates the lining of your blood vessels, making them less elastic and reducing blood flow. Poor circulation is one of the leading causes of erectile dysfunction in aging men. Nitric oxide suppression is the key molecule that allows blood vessels to relax and fill properly during arousal. HFCS and processed sugars reduce NO availability, leading to softer, weaker erections over time. Why no sugar added versions aren't safe either. Many seniors switch to light syrup or no sugar added fruit cups, thinking they're making a smarter choice. Unfortunately, this is a marketing illusion. Even when canned fruit is packed in natural juice or water, it's still stripped of fiber. The canning process removes much of the fruit's natural fiber, which normally slows sugar absorption and stabilizes blood sugar levels. Without fiber, even naturally occurring sugars hit your bloodstream like candy. Chemically preserved, most canned fruit is treated with preservatives and sometimes bleached to maintain its bright color. These chemicals can burden your liver and interfere with hormone metabolism. Sitting in a can for months destroys delicate antioxidants and vitamins, exactly the nutrients your body needs to fight aging and maintain healthy testosterone levels. In short, these fruit cups are far from the fresh, nutrient-rich snack they appear to be. Raymond's story. One of my patients, Raymond, 72, illustrates this perfectly. For over a decade, he ate canned fruit cocktails daily, convinced they were good for his heart. But he constantly complained of fatigue and brain fog, low energy and sluggish mornings, complete loss of sexual desire. When we removed canned fruit from his diet and replaced it with fresh, low-sugar fruits like blueberries and kiwi, everything began to change. Within weeks, Raymond reported better sleep, more energy, and even a return of morning firmness he hadn't experienced in years. What to eat instead? If you want to protect your testosterone and restore your vitality, replace canned fruit cocktails with fresh, whole fruits rich in antioxidants and fiber. Some of the best choices for men over 60. Pomegranate boosts nitric oxide and circulation, protects testosterone from oxidative stress, supports digestion and helps lower cortisol. Watermelon, a natural source of L-citrulline for blood flow. The bottom line: canned fruit cocktails are a senior sweet trap, cheap, convenient, and marketed as healthy, but they quietly sabotage your hormones, circulation, and energy. For men over 60, who already face natural hormonal changes, eating these sugary, processed fruits daily can accelerate decline in ways you may not notice until it's too late. The good news: your body can rebound quickly. Replace processed, syrup-soaked fruit cups with fresh, nutrient-rich options, and you may see better energy, sharper focus, and improved intimacy in as little as a few weeks. 3. Why this healthy snack may be harming men over 60. Bananas are one of the most common fruits in the American diet. They're cheap, easy to grab on the go, and often recommended as a healthy snack. But for men over 60, especially those struggling with low energy, weight gain, or declining sexual vitality, bananas may be doing more harm than good. The hidden problem with bananas and testosterone. Bananas are high in simple sugars, which are quickly absorbed into the bloodstream. This rapid spike in blood sugar triggers an insulin surge, and here's the problem. When insulin levels rise, testosterone levels typically drop. Over time, repeated insulin spikes can contribute to insulin resistance, sluggish metabolism, belly fat accumulation, and reduced testosterone production, exactly the opposite of what aging men need to stay strong, lean, and sexually healthy. The risk is even greater with overripe bananas, which are softer and much sweeter than firm, just ripe bananas. The riper the banana, the more rapidly its sugars are absorbed, creating an even bigger hormonal roller coaster. Bananas, serotonin, and your sex drive. Bananas are also rich in tryptophan, an amino acid that the body uses to produce serotonin, that feel-good neurotransmitter. At first, that might sound like a good thing, but for aging men, too much serotonin at the wrong time can be a problem. While serotonin promotes relaxation and calmness, excess serotonin can leave you feeling emotionally flat, sleepy, or mentally dull. Many of my older male patients have reported feeling sluggish or foggy after eating bananas, especially when eaten as part of breakfast. Why does that matter for men over 60? Because sexual desire and performance require energy, alertness, and emotional engagement. A constant state of calm may feel good for stress relief, but it's not ideal for intimacy. Could bananas be behind lower drive and softer erections? If you're a man over 60 eating 1 or 2 bananas every day and noticing lower morning firmness, reduced sexual desire, increased belly fat or sluggish metabolism, emotional flatness or fatigue after breakfast, then bananas may be part of the problem. This doesn't mean bananas are bad for everyone, but men with declining testosterone, erectile issues, or weight gain may benefit from cutting back, especially on overripe bananas or banana-heavy breakfasts. Better alternatives for energy and vitality. Instead of starting your day with a banana, choose fruits that stabilize blood sugar and support testosterone, such as blueberries, low in sugar, high in antioxidants, and great for protecting testosterone-producing cells. Supports testosterone production while reducing cortisol, the stress hormone that lowers libido. Pomegranate boosts blood flow and nitric oxide, essential for strong erections. The takeaway: bananas aren't necessarily the enemy, but for men over 60 who are serious about maintaining testosterone, energy, and sexual health, they're not always the best choice. If you've been eating bananas daily and struggling with low drive or softer erections, consider replacing them with testosterone-friendly fruits for a few weeks. Many men are surprised at how quickly their energy and confidence return when they make this simple switch. Or, dried fruits, the deceptive, healthy snack that sabotages testosterone. For decades, dried fruits like raisins, dates, figs, and apricots have been marketed as a healthy alternative to processed sweets. They're small, convenient, and often labeled as natural energy boosters. But for men over 60, this seemingly innocent snack can be one of the worst choices for maintaining hormonal balance, energy, and sexual vitality. Why dried fruits are a sugar bomb in disguise. Here's the hard: dried fruits are essentially concentrated sugar. When fruit is dried, most of the water content is removed, leaving behind a highly condensed source of fructose and glucose. A single cup of raisins can pack more sugar than a can of soda. Because the fiber is partially broken down during drying, this sugar enters your bloodstream quickly, causing sharp insulin spikes. And here's why that matters: every time insulin rises dramatically, testosterone tends to fall. High insulin levels interfere with the body's ability to produce and regulate testosterone efficiently. Over time, frequent insulin surges can contribute to insulin resistance, abdominal fat accumulation, and sluggish metabolism, 3 major enemies of male vitality and sexual performance. The hidden chemicals that wreck hormones. It's not just the sugar you need to worry about. Most commercially packaged dried fruits are coated with vegetable oils to keep them from sticking together. These oils are often cheap, refined seed oils that contribute to inflammation, which can negatively affect testosterone production and vascular health. Preserved with sulfites to maintain color and shelf life. Sulfites may seem harmless, but research suggests they can interfere with the body's absorption of key minerals, especially zinc. And why is zinc so important? Zinc is one of the most critical minerals for testosterone production, sperm quality, and erectile strength. Even a mild zinc deficiency can reduce testosterone levels and impair sexual function. The nighttime testosterone trap. One mistake I've seen repeatedly in my clinic is men snacking on dried fruits, especially dates, before bed, thinking they're making a smart, healthy choice. The reality is the opposite. When you eat dried fruits late at night, your blood sugar stays elevated for hours. This disrupts growth hormone release and prevents your testosterone from fully recovering during sleep. Nighttime is when your body naturally rebuilds hormones, repairs tissues, and restores energy levels. Spiking insulin before bed blocks this process, leaving you feeling more fatigued, foggy, and hormonally drained the next day. One of my patients, a 68-year-old retired firefighter, used to snack on a handful of dates every evening to avoid unhealthy desserts. He complained of low energy, poor sleep, and fading sexual drive. Within just 2 weeks of removing dried fruits from his nightly routine, his morning testosterone markers improved, his energy levels increased, and he even reported better sleep and stronger morning erections. The bottom line for men over 60: dried fruits are not the harmless health food they appear to be, especially for aging men. If you're over 60 and dealing with low energy, sluggish metabolism, declining testosterone, weaker erections. Then cutting back or eliminating dried fruits may be one of the simplest changes you can make to protect your hormones and restore vitality. If you do choose to eat them occasionally, select unsweetened, unsulfured organic varieties and keep portions small, no more than a tablespoon or two. But for most men, replacing dried fruits with fresh, low-sugar options like blueberries or kiwi is a much better choice for long-term health and hormonal balance. Pomegranate, the king of circulation for men over 60. When it comes to restoring male vitality naturally, few fruits are as powerful as pomegranate. Often called the king of circulation, this vibrant red fruit has been used for centuries in traditional medicine to improve stamina, energy, and sexual performance. But today, modern science confirms what ancient healers already knew: pomegranate is one of the most effective natural tools for male sexual health, especially for men over 60. Why pomegranate matters for aging men? As men age, two key factors often: testosterone production and healthy blood flow. Both are crucial for maintaining energy, strength, and sexual performance. Pomegranate directly targets these two areas by delivering a unique combination of plant compounds called punicalagins, potent antioxidants found almost exclusively in pomegranate. These punicalagins have been shown to reduce oxidative stress. Oxidative stress damages blood vessels and testosterone-producing cells in the testes. By neutralizing free radicals, pomegranate helps protect these vital cells. Boost nitric oxide. Nitric oxide is the key molecule responsible for relaxing and expanding blood vessels, allowing rich blood flow where you need it most, an essential factor for firm, healthy erections. Improve vascular health. Pomegranate strengthens and cleanses blood vessel walls, supporting overall cardiovascular function. Better circulation means more oxygen and nutrients delivered to muscles, brain, and reproductive organs. For men over 60, these benefits can translate into more consistent energy during the day, improved mental clarity, and a noticeable return of morning firmness. What the science says. Multiple clinical studies have confirmed pomegranate's effects on male sexual health. In one study, men who drank pomegranate juice daily reported improvements in erectile function and increased salivary testosterone levels after just a few weeks. Other research suggests that pomegranate can reduce arterial plaque buildup and enhance vascular responsiveness, which is especially important for men with age-related circulation issues. Unlike synthetic pills that force an artificial response, pomegranate works naturally, improving the root causes of erectile challenges rather than masking them. How to use pomegranate for maximum benefits. If you're a man over 60 looking to restore vitality, the key is consistency. Here's how to make pomegranate part of your daily routine. Fresh pomegranate seeds. Best choice: eat a half cup of fresh seeds daily. They're packed with fiber, antioxidants, and essential nutrients. Add them to yogurt, oatmeal, or salads, or eat them plain. 100% pure pomegranate juice, no sugar added. Drink a small glass, 4 to 6 ounces, daily. Make sure it's unsweetened and labeled as 100% pure juice. Avoid sweetened pomegranate drinks. Many commercial brands add sugar, which can spike insulin and reduce testosterone benefits. Within 3 to 4 weeks, many men notice better energy, improved stamina, and firmer, more reliable performance. Why it's perfect for men over 60. For American men over 60, pomegranate offers a safe, natural way to support sexual health without medication. It not only helps with erections but also promotes overall cardiovascular health, brain function, and energy levels, critical for staying active and confident as you age. Kiwi, the testosterone protector for men over 60. When most men think of fruits that boost testosterone, kiwi rarely makes the list. Yet this small, fuzzy, green fruit is one of the most overlooked treasures for male hormonal health, especially for men over 60 who want to stay strong, energized, and sexually confident. Why vitamin C matters for testosterone. Kiwi is one of the richest natural sources of vitamin C, containing even more per serving than an orange. That's not just good for immune health, it's critical for testosterone production. Vitamin C protects the Leydig cells in your testes, the very cells responsible for producing testosterone. As men age, these cells become vulnerable to oxidative stress, a process where free radicals damage healthy tissue. When Leydig cells are under attack, testosterone levels drop, energy declines, and sexual performance suffers. By regularly eating kiwi, you help shield these cells from oxidative damage, allowing your body to maintain healthier testosterone levels naturally, without supplements or medication. Better digestion, better hormone support. Kiwi isn't just about vitamin C. It contains actinitin, a natural enzyme that improves digestion and nutrient absorption. This is important because as men age, the body's ability to absorb vital minerals like zinc and magnesium declines, and these two minerals are essential for male health. Zinc plays a direct role in testosterone production and sperm quality. Magnesium supports muscle strength, energy metabolism, and hormonal balance. Eating kiwi ensures these minerals are properly absorbed, making every meal more effective at supporting male vitality. Lower cortisol, higher testosterone. Another powerful benefit of kiwi is its effect on cortisol, the stress hormone. Cortisol directly competes with testosterone. When cortisol goes up, testosterone goes down. Chronic stress is one of the biggest hidden testosterone killers for men over 60. Studies have shown that men who eat kiwi regularly experience lower cortisol levels, better emotional stability, and improved sleep quality, all of which create the perfect environment for testosterone to thrive. Better sleep, energy, and intimacy. If you've noticed restless nights, low energy, or a declining sex drive, kiwi may help more than you think. Research shows that eating 2 kiwis a day can improve sleep quality and help you fall asleep faster, increase morning energy and daytime alertness, stabilize mood and reduce feelings of anxiety or fatigue. Good sleep and balanced mood are not just nice to have, they're essential for maintaining libido and sexual confidence as you age. How to eat kiwi for maximum benefits. 1 to 2 kiwis daily, ideally in the evening to support better sleep. Eat the skin if possible. The skin is edible and packed with fiber and antioxidants. Just wash it thoroughly or buy organic. Pair with protein or healthy fats, add kiwi to Greek yogurt, cottage cheese, or a morning smoothie to keep blood sugar stable and improve nutrient absorption. Bottom line, kiwi may be small, but for men over 60, it's a powerhouse for hormonal health. With its high vitamin C content, digestive enzymes, and cortisol-lowering effects, this humble fruit supports testosterone naturally, protects against stress-related hormonal decline, and helps restore the energy, focus, and intimacy that many men fear losing with age. Add kiwi to your daily routine, and within a few weeks, you may notice better sleep, sharper mental clarity, and a renewed sense of vitality, proving that sometimes the simplest foods deliver the biggest result. Nature's Viagra for men over 60. When most people think of watermelon, they picture a refreshing summer snack. But for men over 60, this simple fruit can be far more than just a sweet treat. It can be a powerful natural tool for supporting male performance, circulation, and overall vitality. Watermelon has earned the nickname Nature's Viagra for a good reason. It's naturally rich in a compound called L-citrulline, an amino acid that your body converts into L-arginine. Once converted, L-arginine boosts nitric oxide production, the same process targeted by popular erectile dysfunction medication. Nitric oxide plays a crucial role in male sexual health. It relaxes and expands blood vessels, allowing more oxygen-rich blood to flow throughout the body, including to the areas responsible for strong, lasting erections. But unlike synthetic pills, which force this process and can stress the heart or raise blood pressure, watermelon works with your body gently and safely. Why men over 60 need more nitric oxide? As men age, nitric oxide levels naturally decline. This drop contributes to weaker circulation, slower recovery, and softer erections. Many older men notice reduced morning firmness, lower stamina, and overall loss of confidence, not because of a lack of desire, but because of declining vascular health. Adding watermelon to your daily routine can help reverse this trend naturally. By increasing nitric oxide production, it supports not only sexual performance but also heart health, muscle recovery, and overall energy levels. How to eat watermelon for maximum male benefits. Not all watermelon is equal when it comes to boosting male health. The key lies in how you eat it. Choose fresh, ripe watermelon slices instead of store-bought juice. Most commercial juices are loaded with added sugar, which can spike insulin and harm testosterone. Eat it on an empty stomach when possible. Many of my older patients report the best results when they eat watermelon in the morning or as a midday snack. Include the white rind. This often discarded part of the watermelon contains the highest concentration of L-citrulline. Blend it into a fresh smoothie or juice for a stronger performance-boosting effect. Combine with circulation-friendly ingredients. Some men blend watermelon with a bit of lemon juice or fresh ginger for added vascular support. What results can you expect? Many men in their 60s and 70s who consistently eat watermelon report noticeable changes within a few weeks. Firmer morning erections and improved sexual response. Better stamina and endurance, not just in the bedroom but during physical activities. More consistent energy levels throughout the day. Improved hydration and recovery. which are essential for overall male health. Unlike quick-fix pills, watermelon works gradually, improving vascular health over time. With daily or near-daily use, it can help rebuild the foundation for long-term male vitality. The bottom line for aging men. If you're over 60 and looking for a safe, natural way to boost circulation, protect your heart, and restore your bedroom confidence, watermelon deserves a place in your diet. Think of it not just as a fruit, but as a natural supplement your body already knows how to use. By consistently including fresh watermelon, especially the nutrient-rich white rind, you're giving your body the building blocks it needs to improve blood flow, strengthen erections, and feel more alive. The hormone shield every man over 60 needs. If you're a man over 60, blueberries might just be one of the simplest and most powerful tools you can add to your daily routine. These small, deep blue fruits are far more than a tasty snack. They act as a natural hormone shield, protecting testosterone, improving circulation, and even sharpening mental focus. Things every aging man needs to stay strong, energetic, and confident. So, what makes blueberries so effective? The secret lies in their anthocyanins, the plant compounds responsible for that rich blue color. These potent antioxidants fight oxidative stress, the cellular damage that accelerates aging and weakens testosterone production. By neutralizing free radicals, anthocyanins help keep the Leydig cells in your testes, your testosterone-producing factories, healthy and active. But the benefits don't stop with hormones. Blueberries also help reduce chronic inflammation, one of the biggest enemies of male vitality. Inflammation doesn't just make you feel stiff or achy, it silently damages blood vessels, restricts circulation, and interferes with nitric oxide production. Without healthy blood flow, energy levels drop, erections weaken, and recovery after exercise, or even after a long day, takes longer. Blueberries are also a game-changer for blood sugar stability. Many men over 60 struggle with insulin resistance, which leads to fatigue, weight gain, and lower testosterone levels. Blueberries improve insulin sensitivity, helping your body regulate glucose more efficiently. Stable blood sugar means fewer energy crashes, better hormone balance, and a more consistent mood, key elements of staying mentally sharp and physically ready. And speaking of mental sharpness, blueberries have been linked to better brain health and cognitive function. The same anthocyanins that protect your hormones also improve blood flow to the brain, reducing brain fog and boosting memory. For many older men, this translates to clearer thinking, better decision-making, and a stronger sense of control over their health and daily life. How to eat blueberries for maximum benefits. The good news: you don't need a complicated plan to benefit from blueberries. A simple half cup of fresh blueberries every morning is enough to make a noticeable difference over time. Eat them on their own, sprinkle them over Greek yogurt for extra protein, or blend them into a low-sugar smoothie. For best result, choose fresh or frozen blueberries with no added sugar. Eat them in the morning to stabilize blood sugar early in the day. Pair them with healthy fats or protein, like nuts or yogurt, to slow digestion and keep energy steady. Stick with this habit consistently, and within weeks, many men report better focus, improved drive, and even stronger morning erections. The bottom line: for men over 60, blueberries aren't just a fruit, they're a daily investment in your testosterone, brain, and overall vitality. While they won't replace exercise or a healthy lifestyle, they're one of the easiest, most natural ways to protect your hormones, support circulation, and keep your mind sharp well into your 60s, 70s, and beyond. Bringing it all to how the right fruits can restore your vitality after 60. For men over 60, eating fruit isn't just about grabbing a quick snack, it's a decision that directly impacts your hormones, energy levels, and circulation. Every bite you take can either support your testosterone or slowly sabotage it. That's why making the right fruit choices is essential if you want to stay strong, energetic, and confident well into your 60s, 70s, and beyond. The truth is simple: some fruits silently work against you. Grapes, canned fruit cocktails, bananas, and dried fruits may seem healthy, but they can spike insulin, increase estrogen, and reduce nitric oxide, the key molecule that keeps blood flowing smoothly for firm, healthy erections. Over time, these everyday fruits can leave you feeling sluggish, soft around the midsection, and frustrated with your declining energy and intimacy. But there's good news. For powerful fruits can help reverse that decline naturally. Pomegranate, kiwi, watermelon, and blueberries are nature's secret weapons for men over 60. Packed with antioxidants, circulation-boosting compounds, and testosterone-supporting nutrients, these fruits can help repair blood vessel health, protect hormone production, and restore the vitality you thought was gone for good. Best part? You don't need perfection to see result. You don't have to overhaul your entire diet overnight or eat like a monk. What matters most is consistency. Swapping out hormone-draining fruits for testosterone-friendly options, even just one change a day, can produce noticeable improvements in your energy, mood, and bedroom confidence within weeks. Think of it this way: body still remembers how to feel strong, alive, and fully masculine. It simply needs the right support to unlock that potential again. When you consistently choose foods that work with your body instead of against it, you send your system the signal to produce more testosterone, improve circulation, and regain the stamina and confidence that define true vitality. So start today. Replace that handful of grapes or those dried raisins with a cup of blueberries. Swap the banana for a fresh kiwi. Add a glass of pure pomegranate juice or a slice of watermelon to your morning routine. These small, intentional choices will build on each other, and over time, you'll notice stronger mornings, better energy throughout the day, and a renewed sense of confidence, both in and out of the bedroom. Because after 60, it's not about chasing youth, it's about giving your body the tools it needs to thrive. One bite, one day, one smart decision at a time. Men over 60. Never eat these 3 vegetables, they could be hurting your testosterone. If you are a man over 60, you have likely been advised by doctors, nutritionists, or health magazines to eat more vegetables to protect your heart, maintain a healthy weight, and support overall well-being. While this advice sounds reasonable, it is not the full story. Vegetables are essential for good health, but not all vegetables are equally beneficial for aging men, especially when it comes to testosterone production and prostate health. The truth is that some vegetables, despite being labeled heart-healthy or superfoods, can quietly sabotage your hormonal balance. They may lower your testosterone levels, increase estrogen activity, and worsen inflammation, which directly affects your energy levels, libido, and sexual performance. For men over 60, who are already experiencing natural hormonal decline, the wrong dietary choices can accelerate these age-related changes. In this Senior Vitality Guide, Dr. Marcus Wells, a urologist and men's health specialist with over 3 decades of clinical experience, explains why certain vegetables should be limited or avoided by men over 60 and which vegetables can actually help you restore your vitality naturally. Why men over 60 need to be selective about vegetables. After age 60, your body undergoes significant hormonal shifts. Testosterone levels naturally decline by about 1% per year after midlife, while estrogen levels can rise, especially if you carry extra abdominal fat or consume foods that mimic estrogen in the body. This imbalance affects energy levels. Low testosterone and increased estrogen contribute to constant fatigue. Stiffened arteries reduce blood flow to vital organs, including the penis. Chronic inflammation and hormonal changes may worsen prostate enlargement, leading to urinary problems. Sexual vitality, reduced libido, weaker erections, and loss of confidence are common consequences. Unfortunately, the standard "eat more vegetables" advice does not account for how specific plant compounds can influence male hormones. Certain vegetables are rich in estrogen-like substances, inflammatory fats, or mineral-binding compounds that can make these age-related problems worse. The hidden danger in healthy vegetables. Men often proudly report eating large salads, green smoothies, or plant-based substitutes in an effort to stay healthy. However, as Dr. Wells emphasizes, the type and preparation of these vegetables matter just as much as the quantity. Some seemingly healthy plant-based foods can mimic estrogen activity in the male body, promote chronic inflammation, damaging blood vessels, block the absorption of critical minerals like zinc, essential for testosterone production. For men in their 60s, 70s, and beyond, the impact can be dramatic. Low energy, decreased libido, poor circulation, and declining confidence. 3 common vegetables that may lower testosterone. Dr. Wells identifies 3 vegetables and plant-based foods that are commonly included in healthy diets but can negatively impact men's hormonal health if consumed in the wrong amounts or forms. Soy products, tofu, soy milk, and processed snacks with soy protein contain phytoestrogens, plant compounds that mimic estrogen. In aging men, this can accelerate the natural testosterone decline and reduce sexual vitality. Processed corn products, corn oil, corn syrup, and corn-based margarine are high in omega-6 fatty acids, which promote inflammation and reduce nitric oxide production, impairing blood flow. Raw spinach, in excess, large quantities of raw spinach are high in oxalates, which bind to zinc and prevent absorption. Zinc is crucial for testosterone production and prostate health. These vegetables are not inherently bad, but their impact depends on how often and in what form you consume them. You can restore vitality naturally. Avoiding or modifying these 3 foods is the first step. The next step is to intentionally add vegetables that support male hormones, circulation, and prostate health. Well's top recommendations for men over 60, as they enhance nitric oxide production, balance estrogen, and protect testosterone from conversion into inactive forms. With the right dietary approach, you can improve energy, restore confidence, and protect your prostate health, naturally, without relying on pills or hormone replacement therapy. Soy has been marketed as a healthier alternative to red meat, especially for heart health. Tofu, soy milk, and edamame often appear on lists of heart-friendly and cholesterol-lowering foods. But what many men over 60 don't realize is that soy can have unintended hormonal consequences that directly affect energy function and overall vitality. Soy is rich in phytoestrogens, plant-derived compounds that closely mimic estrogen in the human body. While these compounds are harmless in small amounts for most people, they can interfere with a man's natural hormonal balance, especially later in life. As men age, testosterone production naturally declines. This decline is part of the normal aging process, but when additional estrogen-like substances enter the body through diet, it pushes the balance even further toward estrogen dominance. Phytoestrogens can bind to estrogen receptors, signaling the body to produce less testosterone. Testosterone is essential for muscle mass and energy production. Lower levels leave many men feeling chronically tired and weaker. Testosterone drives sexual desire and performance. Men with elevated estrogen often report waning erections, decreased sensitivity, and loss of confidence in intimate situations. An unfavorable estrogen to testosterone ratio encourages fat accumulation, especially around the midsection, which further suppresses testosterone by increasing aromatase activity, the enzyme that converts testosterone into estrogen. Even if you don't drink soy milk or eat tofu, soy often sneaks into the diet through processed and packaged foods, protein bars and shakes, meal replacement powders, processed sauces and salad dressings, packaged healthy snacks, many plant-based meat substitutes. Soy is inexpensive and used widely in the food industry as a filler or protein booster, so men often consume far more of it than they realize. Men over 60 should aim to limit or completely avoid soy-based products, especially if they are already experiencing symptoms of low testosterone, fatigue, or reduced sexual performance. Wild-caught salmon and fatty fish, rich in omega-3s that reduce inflammation and support vascular health. Pasture-raised poultry, a lean, clean source of protein without added hormones. Grass-fed beef, provides zinc and creatine, both critical for testosterone production and muscle maintenance. Organic eggs, contain healthy fats, choline, and essential amino acids that support hormone production. If you're buying packaged foods, always read labels carefully. Look for ingredients like soy protein isolate, soy lecithin, or soybean oil, and choose alternatives without them. Processed corn and corn oils, the hidden inflammation trigger for men over 60. When it comes to maintaining energy, circulation, and testosterone levels after 60, inflammation is one of your greatest enemies. And one of the biggest dietary contributors to chronic inflammation in older men isn't sugar or even red meat, it's processed corn and corn oils. Let's be clear, fresh corn on the cob, especially when eaten occasionally in its natural state, is not the problem. The real issue is the industrialized corn products that have infiltrated nearly every processed food in the modern American diet. Corn oil, commonly labeled as vegetable oil on ingredient lists. Corn syrup and high fructose corn syrup. Corn starch and other corn-based fillers in packaged foods. These products are cheap, heavily processed, and widely used in salad dressings, baked goods, fried foods, margarine, and even so-called health snacks. Why processed corn products are so harmful for men over 60? The problem lies in their very high omega-6 fatty acid content. While omega-6 fats are not inherently bad, consuming them in excess, especially when your omega-3 intake is too low, throws off the critical omega-6 to omega-3 balance in your body. For optimal health, humans need roughly a 1, but the typical American diet today averages 15:1 or even 20:1. And processed corn products are a major reason for this imbalance. This skewed ratio drives chronic low-grade inflammation, which slowly damages your body over time. For men over 60, the consequences can be serious. Damage to arterial wall. Inflammation irritates the endothelium, the delicate lining of your arteries. Healthy arteries produce nitric oxide, which relaxes and widens blood vessels for optimal circulation. When inflammation damages the endothelium, nitric oxide levels drop. Stiffened blood vessels, reduced nitric oxide and persistent inflammation, arteries become less flexible, making it harder for blood to flow freely. Compromised blood flow to vital organs, including the penis. Poor circulation contributes to erectile dysfunction, lower energy, and even cognitive decline. Chronic inflammation is also associated with enlarged prostate, joint pain, fatigue, and faster aging, issues that become more pronounced after 60. Action plan for better hormonal and vascular health. If you want to protect your testosterone, circulation, and vitality, eliminating processed corn products is one of the simplest yet most powerful dietary changes you can make. What to avoid? Foods fried in vegetable oil, which often contains corn oil. Packaged snacks, chips, and baked goods. Margarine and processed spreads. Any food with corn syrup or high-fructose corn syrup on the label. What to eat instead? Focus on increasing your omega-3 intake to counterbalance years of omega-6 overload. Include foods like fatty fish, sardines, mackerel, wild-caught salmon, nuts and seeds, walnuts, flaxseed, chia seeds. High-quality fish oil or krill oil supplements. Replacing corn-based oils with extra virgin olive oil or avocado oil for cooking is also an excellent choice for men over 60 who want to reduce inflammation and support heart and prostate health. The bottom line: for men striving to maintain strong circulation, healthy testosterone levels, and overall vitality well into their 60s and beyond, processed corn and corn oils are silent saboteurs. By removing them from your daily diet and increasing your omega-3 intake, you can dramatically reduce systemic inflammation, protect your arteries, and restore better blood flow, vital for both heart health and sexual performance. Raw spinach in excess, the hidden zinc blocker. Spinach has earned its reputation as one of the healthiest vegetables, packed with magnesium, iron, and antioxidants that support heart health and overall vitality. However, for men over 60 who rely on large amounts of raw spinach, especially in daily green smoothies, there's an overlooked downside. Raw spinach contains high levels of oxalates, naturally occurring compounds that bind to minerals in your digestive tract. When oxalates attach to minerals such as zinc, calcium, or magnesium, these nutrients pass through your system instead of being absorbed. For younger individuals, this might not pose a significant issue, but for older men, the consequences can be substantial. Zinc, in particular, is critical for testosterone production, prostate health, and sexual function. Even if you're eating zinc-rich foods like shellfish, beef, or pumpkin seeds, excessive raw spinach can block its absorption, leaving you with suboptimal levels. Why zinc matters so much after 60. Supports testosterone production. Zinc is a cofactor for enzymes that stimulate testosterone synthesis. Low zinc levels directly correlate with reduced testosterone output, which can lead to fatigue, loss of muscle mass, and diminished libido. Protects prostate health. Zinc accumulates in high concentrations in the prostate gland, where it helps regulate cell growth and inflammation. Chronic zinc deficiency has been linked to enlarged prostate and prostate dysfunction. Enhances immune and sexual health. Zinc plays a role in sperm production, wound healing, and immune defense, all crucial for maintaining vitality as you age. How to eat spinach without losing its benefits. You don't need to eliminate spinach altogether. It remains a nutrient powerhouse when prepared correctly. The key is how you cook it. Lightly steam or sauté spinach. Just a few minutes of heat dramatically lowers its oxalate content, allowing zinc and other minerals to remain available for absorption. Pair with zinc-rich foods. A spinach and egg scramble or sautéed spinach with grass-fed beef or oysters can boost mineral intake. Limit raw spinach. Swap daily raw spinach blends for cooked spinach dishes several times a week. By making this small change, many men notice gradual improvements in energy, mood, and sexual health as zinc levels normalize. The 3 testosterone-boosting vegetables men over 60 should be eating. Now that you know how to handle spinach properly, let's focus on 3 vegetables that actively support testosterone production, circulation, and overall vitality. Beets, the natural circulation enhancer. Beets are among the best natural sources of dietary nitrates, which your body converts into nitric oxide. NO relaxes and widens blood vessels, improving circulation and oxygen delivery. Better circulation means more nutrients and oxygen reaching muscles, the heart, and sexual organs. For men over 60 struggling with low energy, cold extremities, or erectile challenges, beets can be a game changer. Best way to eat beets: fresh, raw grated beets in salads. Lightly roasted or steamed beets to preserve nitrates. Avoid pickled or canned beets. Heat and brining reduce nitrate content and add excess sodium. 2. Broccoli, the hormone balancer. Broccoli is a nutritional powerhouse, especially for men concerned about hormone balance. It's rich in sulforaphane, a compound that supports liver detoxification, reduces inflammation, and helps the body metabolize and eliminate excess estrogen. As men age, testosterone naturally declines, and estrogen tends to rise, a hormonal shift that contributes to belly fat, prostate issues, and lower libido. Broccoli helps restore a healthier testosterone to estrogen ratio. Best way to eat broccoli: steam lightly for 3 to 4 minutes to preserve sulforaphane. Eat raw with a healthy dip like hummus or guacamole. Avoid microwaving or overcooking, it destroys sulforaphane's potency. White button mushrooms contain natural aromatase inhibitors. Aromatase is the enzyme that converts testosterone into estrogen, and its activity increases with age and abdominal fat. By blocking aromatase, mushrooms help preserve the free, active testosterone you already produce. More free testosterone translates into stronger muscles, sharper mental focus, higher libido, and improved mood, all essential for aging well. Best way to eat mushrooms: sauté lightly with olive oil and garlic a few times per week. Add to omelets, soups, or stir-fries. Combine with zinc-rich foods to enhance overall hormonal support. Bonus tip: don't overlook boron, the forgotten mineral for testosterone support. When it comes to men's health, zinc and magnesium usually dominate the conversation. But there's another powerful nutrient that often gets ignored: boron. For men over 60 who want to maintain strength, energy, and sexual vitality, boron can make a noticeable difference. Why boron matters for men over 60? Boron plays a unique role in regulating testosterone availability. It works by lowering levels of sex hormone-binding globulin, a protein in your blood that binds to testosterone and makes it inactive. Think of SHBG as a lockbox that stores testosterone, keeping it out of reach for your muscles, brain, and reproductive system. Even if your total testosterone levels look normal on paper, high SHBG can leave you feeling tired, mentally foggy, and with a lower sex drive because very little testosterone is actually available to your tissues. By reducing SHBG, boron helps increase free testosterone, which is the active form your body uses to build muscle, maintain energy, support mental clarity, and fuel a healthy libido. Top boron-rich foods for senior men. Men over 60 don't need expensive supplements to get enough boron. Simple, everyday foods can do the job. A nutrient-dense superfood that supports hormone balance and provides healthy fats for heart and prostate health. A concentrated source of boron that is easy to add to breakfast or yogurt. Naturally sweet, rich in boron and minerals, and perfect as an afternoon snack for quick energy. Known for supporting bone health, prunes also deliver a solid dose of boron, helping older men maintain strength and vitality. Easy ways to add boron to your diet. Sprinkle a handful of raisins or chopped dates over your morning oatmeal. Add sliced avocado to your eggs or salads for lunch. Snack on prunes or dates in the afternoon instead of processed sweets. These small, consistent dietary habits can help optimize your hormone balance, keeping more testosterone free and active where your body needs it most. Boron might not be as famous as zinc or magnesium, but for men over 60, it can be the missing link to better energy, stronger bones, improved mental focus, and a healthier sex drive. Reclaiming your strength, energy, and confidence after 60. If you are a man over 60, aging does not have to mean losing your strength, your drive, or your masculinity. Too many men are unknowingly sabotaging their health with so-called healthy food choices. They are doing what they've been told for years, replacing red meat with soy, swapping butter for corn-based margarine, loading up on raw spinach smoothies, and yet they feel more tired, weaker, and less like themselves with every passing year. The truth is simple but powerful: the wrong foods, even healthy ones, can quietly disrupt your hormones, stiffen your arteries, and rob you of the energy and vitality that make you feel alive. But the good news is just as simple: your body can bounce back quickly when you feed it the right way. Start by removing the hidden saboteurs. Cut out soy, which floods your body with estrogen-like compounds at a time when you need every bit of testosterone you can hold on to. Avoid processed corn oils and corn syrup, which fuel chronic inflammation and restrict blood flow where it matters most. And if you're drinking daily green smoothies, rethink that habit. large amounts of raw spinach can bind to zinc, leaving you without the very mineral your prostate and testosterone depend on. N. Build your meals around vegetables that work with your body, not against it. Beets improve circulation by increasing nitric oxide, opening your blood vessels and restoring strong, healthy blood flow. Broccoli helps detox excess estrogen, supporting the testosterone to estrogen balance that keeps you lean, sharp, and energetic. White button mushrooms protect your existing testosterone by blocking aromatase, the enzyme that steals testosterone and turns it into estrogen as you age. These are not gimmicks. There are no pills, powders, or quick fixes involved. Just smart, science-backed food choices that directly influence your hormones, your circulation, and your confidence. The changes can happen faster than you think. Many of my patients notice stronger morning energy, improved focus, and better performance in just a few weeks. Here's the truth every man over 60 needs to hear. You are not losing your masculinity because you're getting older. You are losing it because no one taught you how to eat for a man's body after 60. But you can change that starting today. Every bite you take is either feeding your vitality or slowly draining it. Make the right choice. Ditch the foods that weaken you and embrace the ones that rebuild you. Your strength, your clarity, and yes, your confidence can return. Aging doesn't have to mean slowing down. With the right foods on your plate, you can stay strong, capable, and fully alive, at 60, 70, and well beyond. Because getting older is inevitable, but losing your manhood is not.
The truth about protein after 50 to 10 foods that beat eggs for muscle and longevity. If you're over 50, you've probably been told that eggs are one of the best sources of protein you can eat. And while they are a great option, what if we told you that there are 10 other foods that offer even more protein per gram and maybe even more effective in helping you stay strong, mobile, and independent as you age? The truth is, muscle loss isn't just about aging, it's about the choices we make every day. After age 50, your body naturally begins to lose muscle mass. This process, known as sarcopenia, can lead to weakness, poor balance, slower walking, and a higher risk of falls or fractures. But here's the good news. You can fight back and even reverse it by choosing the right protein-rich foods. In this article, we'll walk you through 10 powerful foods that pack more protein per 100 grams than eggs, and some of them may already be hiding in your pantry. These are science-backed, easy to digest, and perfect for older adults looking to stay strong without resorting to expensive supplements. Let's dive in. Greek yogurt has become a staple in many kitchens, but few realize just how protein-dense it is, especially the non-fat, triple-strained kind. Compared to a boiled egg's 6.3 g of protein, Greek yogurt nearly doubles the content with less fat and more digestibility. A 2020 study in Nutrients found that older adults who consumed at least 20 g of daily saw a 25% improvement in muscle preservation over 12 weeks, particularly when paired with regular walking. Choose plain, non-fat versions and mix with berries or flaxseed for extra fiber and anti-inflammatory benefits. These legumes offer a rich source of plant-based protein and fiber. That fiber improves digestion and blood sugar control, both essential for maintaining muscle health in older adults. Research in the American Journal of Clinical Nutrition found that replacing some animal protein with legumes like chickpeas reduced muscle loss by up to 26%. Try them in soups, hummus, or roasted for a crunchy, high-protein snack. Quinoa is a complete protein, meaning it contains all 9 essential amino acids your body needs to build and repair muscle, something most grains can't do. Even more impressive, it's high in lysine, an amino acid critical for calcium absorption and collagen production. One 2022 study found seniors who ate quinoa daily increased leg strength by 9% over 8 weeks. Soak it overnight to improve nutrient absorption and cook it in low-sodium broth for better flavor. Pumpkin seeds, or pepitas, are packed with protein and vital minerals like magnesium, zinc, and iron nutrients that support muscle contraction, oxygen delivery, and cellular repair. A Journal of Medicinal Food study found that daily pumpkin seed consumption reduced muscle inflammation markers by 38% in just 12 weeks. Eat them raw and unsalted, toss on salads, or blend into smoothies. Tempeh 20 g protein, 100 g. Tempeh is made from fermented soybeans and provides all essential amino acids, including leucine, a key driver of muscle growth. The fermentation makes it easier to digest, which is important after 50, when gut health can impact how well your body uses protein. Incorporating tempeh into your meals can improve muscle retention and support gut health at the same time. Add to stir fries, sandwiches, or salads for a satisfying plant-based boost. Spirulina 29G protein. This blue-green algae may not look like food, but spirulina contains nearly triple the protein of eggs and is over 80% bioavailable, meaning your body absorbs it fast and efficiently. A 2022 study in nutrients found that spirulina reduces CRP, a key marker of inflammation, by 32% and boosts nitric oxide, improving blood flow to muscles. Add a teaspoon to smoothies, oatmeal, or protein bites. Hemp seeds, 35G protein, 100G. Hemp seeds are a complete protein source and rich in omega-3s, which help reduce joint pain and inflammation. They're also incredibly easy to digest and perfect for seniors with sensitive digestion. Sprinkle over warm vegetables, yogurt, or blend into smoothies for an effortless protein upgrade. Seitan is made from vital wheat gluten, offering nearly 40G of protein per 100G more than beef or chicken. It's low in fat, easy to digest, and ideal for seniors managing diabetes or heart disease. A 2022 study found plant protein isolates like seitan help seniors retain 21% more lean muscle mass compared to a mixed diet. Grill, saute, or roast it seitan takes on whatever flavor you cook it with. Parmesan cheese, 42G protein, 100G. Real Parmesan, the aged, hard kind, not the powdery stuff, contains 42G of protein per 100G. Because it's aged, it's low in lactose and easy to digest. A 2019 study in nutrients showed seniors absorbed amino acids from aged cheese 30% better than from meat. It also provides a hefty dose of leucine, crucial for preventing age-related muscle loss. Sprinkle on vegetables, pasta, or eggs, just don't overdo it, as it's also rich in sodium. Dried whitefish powder, like cod, provides a whopping 63G of protein per 100G, the most concentrated food-based source of protein available today. In a 2020 trial, seniors who consumed fish powder daily increased muscle mass by 19% over 10 weeks without changing their exercise routine. Mix into soups, stews, or soft-cooked meals for an easy-to-eat, nutrient-dense addition. It's ideal for those with chewing difficulties or reduced appetite. Final thoughts. Why protein matters even more after 50. As we age, one of the most silent yet dangerous threats to our health isn't heart disease or memory loss, it's muscle loss. And unfortunately, it often begins without any warning. Many adults over 50 assume that becoming weaker, slower, or more fatigued is just a normal part of aging. But in reality, much of that decline stems from something entirely preventable, not getting enough of the right kind of protein. After age 50, your body becomes significantly less efficient at absorbing and using protein. That means even if you're eating the same amount as you did in your 30s, your muscles may still be starving for fuel. The result? Shrinking strength, poor balance, slower recovery, and an increased risk of falls, fractures, and hospitalizations. Most Americans in their 50s, 60s, and beyond rely on traditional protein sources like eggs, chicken, or dairy. And while these foods do have value, they often fall short of what aging muscles truly need. Here's the truth. You need more than just protein. You need high-quality, bioavailable, nutrient-dense protein that your body can actually absorb and use. And that's exactly what the 10 foods in this list offer. Unlike many processed protein powders or generic meal plans, these real foods come packed with anti-inflammatory properties, essential amino acids, minerals like magnesium and zinc, and even natural compounds that support digestion and nutrient absorption. They're not just high in protein, they're smart fuel for your aging body. And here's the best part. You don't have to eat all 10 foods every single day to feel the difference. Just incorporating 2 to 3 of these options into your weekly meals can have a measurable impact on your every single day. Muscle strength and tone, joint stability and balance, energy and stamina throughout the day, immune health and inflammation levels, recovery time from activity or illness. Think about this. Every bite is either building you up or breaking you down. The small, consistent choices you make today, what's on your plate, how you fuel your body, how you nourish your muscles, can shape the next 10, 20, even 30 years of your life. So if you're serious about aging, well, staying mobile, and remaining independent long into your 70s and 80s, protein isn't optional, it's essential. Eggs are good, but they're not enough. The good news is, now you know what is. Because after 50, is not just about living longer, it's about living stronger, smarter, and on your terms. Stay strong, stay informed, and keep fueling the future you deserve, one powerful meal at a time. If you found this article helpful, be sure to subscribe to our YouTube channel for more science-backed health advice tailored to adults 50 and older. And let us know in the comments, which food surprised you the most? Your body will thank you.
As a prostate doctor, I warn seniors, this habit may be enlarging your prostate. If you're a man over 60, what you're about to read could mean the difference between enjoying peaceful, uninterrupted nights, or spending years struggling with urinary discomfort, frequent bathroom trips, and restless sleep. Every day, millions of American men in their 60s, 70s, and even 80s are making simple but harmful mistakes that quietly damage their prostate health. The problem is, these habits often feel harmless or even normal with age. Most men don't think twice about them. As a prostate specialist, I see it all the time. Men walk into my clinic frustrated, tired, and worried because they're waking up 3, 4, sometimes 5 times a night to urinate. Many of them feel embarrassed or believe it's just part of getting older. But that's not entirely true. Aging does affect the prostate, yes, but daily habits play a much bigger role than most men realize. The truth is, small actions you take, or don't take, every single day can determine whether your prostate stays healthy or becomes enlarged, swollen, and inflamed. And here's the most important, it's never too late to change course. I've treated men in their late 70s and early 80s who reversed many of their urinary symptoms simply by adjusting these habits. So, if you're tired of sleepless nights, slow or difficult urination, that constant feeling that your bladder isn't empty, or the embarrassment of having to plan your day around bathroom trips, keep reading. Understanding these mistakes could spare you from years of discomfort, medication, or even surgery. In the next section, I'll break down the 10 daily habits that may be silently enlarging your prostate, and more importantly, I'll show you what to do instead to keep your prostate healthy, even as you age. Your prostate health is in your hands more than you think. And for men over 60, every small change counts. Chronic stress is far more dangerous than most realize, especially for your prostate. It is one of the most underestimated risk factors for prostate enlargement and urinary problems. When you're under constant stress, your body releases high levels of cortisol, the primary stress hormone. Elevated cortisol disrupts almost every system in your body. It tightens the muscles in your pelvic region, reducing blood flow to the prostate and bladder. This restriction of circulation means your prostate receives fewer nutrients and less oxygen, slowing its ability to repair itself. Over time, this leads to irritation, inflammation, and gradual gland enlargement. Stress also wreaks havoc on your hormones. Men under long-term stress often experience a drop in testosterone and an increase in estrogen, which can directly contribute to prostate growth. On top of that, stress weakens your immune system, making you more vulnerable to infections in the urinary tract and prostate. One of the clearest signs of stress-related prostate issues is urinary urgency, rushing to the bathroom frequently, especially at night. Many men attribute this solely to aging, but stress-induced inflammation is often a major factor. Tightened pelvic muscles also make it harder to completely empty the bladder, leaving urine behind and increasing the risk of further irritation. The good news is that you can reverse much of this damage by actively managing stress. Even small daily habits can calm your nervous system and protect your prostate. Deep breathing and relaxation. Just 5 to 10 minutes of slow, controlled breathing lowers cortisol levels and relaxes pelvic muscles. Light stretching and gentle exercise, yoga, tai chi, or simple morning stretches improve circulation and reduce tension in the pelvic area. Quiet time or meditation. Taking even 10 minutes of silence daily resets your nervous system and lowers inflammation markers. Laughter and social connection, spending time with friends or family, sharing stories, or simply laughing releases feel-good hormones that counteract cortisol. Consistent, quality sleep, restorative sleep regulates hormone balance, allowing your prostate to heal overnight. Aim for 7 to 8 hours of uninterrupted rest. A short walk in fresh air or exposure to natural sunlight boosts mood, supports hormone health, and relieves tension. Stress management isn't just about feeling better. It's a medical necessity if you want to reduce urinary symptoms and keep your prostate healthy as you age. The sooner you begin, the faster your body, and your prostate, can recover. It's a major risk factor for prostate problems, especially for men over 60. Abdominal fat is biologically active, meaning it doesn't just sit there, it releases inflammatory chemicals called cytokines that circulate through your body, including the prostate. This constant, low-grade inflammation irritates prostate tissue, making it more likely to swell and enlarge over time. Belly fat also disrupts your hormonal balance. As abdominal fat accumulates, it converts testosterone into estrogen, lowering your testosterone levels and increasing estrogen levels. This imbalance is directly linked to prostate growth and can also affect sexual function, leading to reduced libido and erection difficulties. Additionally, excess belly fat puts physical pressure on your bladder and surrounding pelvic organs, making urinary symptoms, like frequent nighttime trips to the bathroom or difficulty emptying the bladder, much worse. Research consistently shows that men with larger waistlines are significantly more likely to experience benign prostatic hyperplasia, BPH, erectile dysfunction, and even more severe urinary retention issues. For older men, this combination of hormonal imbalance, inflammation, and pelvic pressure creates a perfect storm for prostate discomfort. So what's the solution? Start by setting a realistic goal. Aim for a waist circumference under 40 inches. You don't need extreme dieting or exhausting workouts. Instead, focus on slow, sustainable changes. Gentle exercise, daily walks, light stretching, or low-impact activities like swimming or cycling improve circulation, help burn fat, and reduce pelvic pressure. Even 20 to 30 minutes a day can make a noticeable difference. Portion control. Reducing portion sizes and avoiding second helpings is an easy way to cut calories without feeling deprived. Limit sugar and processed carbs. High-sugar foods and refined carbs spike insulin levels, encouraging more fat storage around the waist. Replacing them with whole grains, vegetables, and lean protein supports steady weight loss and better hormonal balance. Losing even 5 to 10 pounds can dramatically ease urinary symptoms and lower inflammation. Remember, your waistline isn't just about appearance, it's a key indicator of your prostate health. Taking steps to reduce belly fat can lead to fewer nighttime bathroom visits, improved sexual function, and better overall well-being as you age. Eating too much red meat. For many American men, a juicy steak or a burger feels like a well-deserved comfort food, but after 60, eating red meat too often can quietly take a toll on your prostate. Red meat, especially processed meats like bacon, sausage, and deli cuts, has been strongly linked to increased inflammation in the body. This isn't just about short-term discomfort. Chronic inflammation is one of the key factors that lead to prostate enlargement over time. One of the biggest concerns with processed red meats is the chemical additives, preservatives, and high levels of saturated fat they contain. These substances can disrupt hormonal balance, particularly by affecting testosterone and estrogen levels, both of which play a role in regulating prostate size. Additionally, processed meats tend to generate higher oxidative stress in the body, which damages cells and weakens the tissues surrounding the prostate. Another issue that becomes more relevant after 60 is digestion. As we age, our digestive system slows down, making it harder to break down heavy, fatty meats. This slower digestion can lead to bloating, weight gain, and added pressure in the pelvic area, which indirectly affects the prostate by increasing irritation and urinary discomfort. The solution isn't to completely give up red meat, but to enjoy it in moderation. Limit red meat consumption to once or twice a week, and when you do eat it, choose leaner cuts like sirloin or tenderloin instead of fatty steaks or processed varieties. Even better, replace some of those meat-heavy meals with healthier protein sources. Grilled fish, skinless chicken, beans, lentils, and other plant-based options not only provide essential nutrients but are also rich in fiber, which supports better digestion and helps reduce overall inflammation. Making this simple shift in your diet won't just benefit your prostate, it will also improve heart health, maintain a healthy weight, and give you more energy as you age. Over time, these changes can mean fewer urinary symptoms, less nighttime discomfort, and a stronger, healthier prostate well into your senior years. Skipping annual checkups. Far too many men wait until symptoms become unbearable before visiting a doctor, and this delay can be costly, especially after age 60. Prostate enlargement, or benign prostatic hyperplasia, often develops gradually and without obvious warning signs. By the time urinary issues like frequent nighttime trips, weak urine flow, or bladder discomfort appear, the prostate may already be significantly enlarged. Regular checkups are your best defense. A yearly visit to your urologist or primary care physician allows for early detection of subtle changes that you might not notice on your own. 2 simple exams are essential. Digital rectal exam, DRE. Though quick and slightly uncomfortable, this manual exam helps the doctor feel the size, shape, and texture of your prostate, detecting lumps or irregularities that could indicate BPH or even early-stage prostate cancer. PSA test, prostate-specific antigen. This blood test measures PSA levels, which can rise due to inflammation, enlargement, or cancer. When monitored annually, your doctor can track changes over time and act early if levels begin to climb. Early detection often means early, less invasive solutions, simple lifestyle changes, dietary adjustments, or mild medications instead of stronger drugs or surgery. It can also prevent complications like urinary retention, infections, or kidney strain. Many men feel embarrassed discussing urinary or prostate issues, but doctors are trained to handle these concerns professionally and discreetly. Remember, prevention is always easier than treatment. If you are over 60, commit to at least one annual prostate health appointment and talk openly about any urinary changes, even if they seem minor. Taking this step now can save you from years of discomfort and protect your long-term health. Smoking or exposure to smoke, a hidden but serious threat to your prostate. If you are over 60, smoking, or even just being around smokers, can quietly do lasting damage to your prostate. Many men underestimate how harmful tobacco smoke really is, but the chemicals in cigarettes affect nearly every organ in the body, including the prostate. When you inhale cigarette smoke, toxic substances like nicotine and tar restrict blood flow and reduce oxygen delivery to delicate tissue. Poor circulation means your prostate doesn't get the nutrients and oxygen it needs to repair itself. Over time, this leads to chronic inflammation, which is one of the primary drivers of prostate enlargement. Inflammation also increases the risk of developing prostatitis, painful prostate inflammation, and can, in severe cases, raise the risk of prostate cancer. But the danger isn't limited to smokers themselves. Secondhand smoke, breathing in smoke from other people's cigarettes, has been shown to cause the same type of oxidative stress and tissue damage. For older men, whose bodies already repair more slowly with age, this constant exposure can speed up prostate problems significantly. The good news is that your body begins to heal quickly after you quit smoking. Within just a few weeks of quitting, blood circulation improves, inflammation decreases, and the prostate starts recovering from years of irritation. The longer you stay smoke-free, the lower your risk of future complications. If you have already quit smoking, you're on the right path, but it's still important to stay away from smoky environments. Regular exposure to secondhand smoke can undo much of the progress your body is making to heal itself. Choose smoke-free restaurants, avoid gatherings where people smoke indoors, and encourage family or friends who smoke to do it outside. For men who are still smoking, talk to your doctor about quitting strategies. Nicotine replacement therapies, prescription medications, or even natural approaches like mindfulness and breathing exercises can help you quit for good. At any age, it's worth making this change, not just for your lungs and heart, but for your prostate health as well. Holding in urine. Many men over 60 have developed the habit of holding it in, either because they are busy, don't want to interrupt an activity, or simply don't want to make another trip to the bathroom. But this habit can quietly cause serious damage to your prostate and urinary system. When you ignore the urge to urinate, your bladder stretches beyond its normal capacity. Since the prostate sits just below the bladder, this extra pressure directly affects it. Repeatedly forcing the bladder to hold urine for too long leads to irritation and swelling of prostate tissue. Over time, the muscles in both the bladder and prostate can weaken, making it harder to fully empty your bladder when you finally do go. Another hidden danger is stagnant urine. When urine sits too long in the bladder, it becomes a breeding ground for bacteria, increasing the risk of urinary tract infections and chronic inflammation. For men with an already sensitive or enlarged prostate, this trapped urine worsens symptoms like urgency, burning, and nighttime trips to the bathroom. The solution is simple but crucial. Listen to your body. Go to the bathroom as soon as you feel the urge, even if it's inconvenient. For men over 60, this one habit alone can prevent worsening urinary problems, reduce irritation, and protect prostate health for years to come. Eating spicy or processed food. Why it's hurting your prostate. Enjoying a spicy dish once in a while isn't a problem, but making hot sauces, chili peppers, or heavily seasoned meals a daily habit can slowly irritate your prostate without you even noticing. Spicy foods stimulate your body's inflammatory response. For men over 60, whose tissues are already more sensitive, this extra inflammation can lead to prostate swelling, urinary urgency, and discomfort over time. Processed foods are an even bigger problem. Items like chips, bacon, sausage, deli meats, frozen dinners, and fast food are packed with preservatives, artificial colorings, excess sodium, and unhealthy fats. These ingredients create a perfect storm for your prostate. Excess sodium makes your body retain fluid, putting added pressure on your bladder and prostate. Unhealthy fats, especially trans fats and saturated fats, disrupt hormone levels, including testosterone and estrogen, which directly influence prostate size and health. Chemical additives and preservatives can trigger low-grade, chronic inflammation throughout the body, making prostate tissue more reactive and swollen. Over time, this silent irritation worsens urinary symptoms, nighttime trips to the bathroom, difficulty starting or stopping urine flow, and that constant feeling that your bladder never fully empties. The good news: you don't have to give up flavorful meals to protect your prostate. Shift to an anti-inflammatory diet that supports hormonal balance and tissue repair. Focus on fresh vegetables and fruits, rich in antioxidants that fight inflammation. Fatty fish like salmon or sardines, packed with omega-3 fatty acids that protect prostate tissue. Nuts and seeds provide healthy fats that help regulate hormone production. Herbs and mild spices, swap out hot sauces for turmeric, basil, oregano, or rosemary, which actually reduce inflammation. Think of every meal as a choice between fueling irritation or supporting healing. By cutting back on processed and overly spicy foods, you give your prostate the chance to calm down, shrink naturally, and function better. Caffeine is a natural stimulant and diuretic, which means it increases urine production and stimulates bladder activity. This can lead to more frequent trips to the bathroom throughout the day and night, disrupting your sleep and daily routine. Beyond just making you urinate more often, caffeine also causes the muscles of the bladder to contract more frequently and sometimes unpredictably. These involuntary contractions create a strong and sudden urge to urinate, sometimes leading to leakage or difficulty holding urine long enough to reach a bathroom. This urgency can be frustrating and embarrassing, affecting your quality of life. Additionally, caffeine has the effect of tightening the muscles around the bladder neck, the area that controls the flow of urine from the bladder. When these muscles contract excessively, it becomes harder to fully empty the bladder. Incomplete emptying means urine stays trapped in the bladder longer, creating pressure on the prostate gland, which sits just below the bladder. Over time, this added pressure can cause inflammation and swelling of the prostate, worsening symptoms like urinary frequency, urgency, and discomfort. It's important to note that the effect of caffeine varies from person to person. Some men can tolerate a morning cup of coffee with no issues, but problems usually arise when multiple caffeinated drinks, like additional coffee cups, sodas, or energy drinks, are consumed throughout the day. For men over 60, it's wise to limit caffeine intake to 1 cup early in the morning and avoid caffeine later in the day. If you find your urinary symptoms worsen with caffeine, consider replacing your afternoon or evening coffee with decaffeinated coffee, herbal tea, or simply water. These alternatives hydrate without irritating your bladder or prostate. Making this small change can reduce bladder spasms and nighttime trips to the bathroom, improving both prostate health and overall comfort. However, prolonged sitting can quietly harm your prostate health in several important ways. When you remain seated for extended stretches, you place continuous pressure on the pelvic area, where your prostate gland is located just beneath the bladder. This constant pressure restricts proper blood circulation to the pelvic region. Good blood flow is essential to keep tissues healthy and free from inflammation. When circulation slows down, it creates an environment where inflammation can develop and persist. Additionally, sitting too long weakens your pelvic floor muscles, the group of muscles that support your bladder and prostate function. Strong pelvic floor muscles are necessary to fully empty your bladder during urination. But when these muscles become weak from inactivity, urine tends to remain trapped in the bladder after you go, known as urinary retention. This leftover urine can irritate your prostate further and increase your risk of infections. The combination of pressure, reduced circulation, and weak muscles contributes to prostate enlargement and worsening urinary symptoms, including urgency, frequency, or difficulty starting and stopping your urine stream. To combat these effects, it's crucial to break up long periods of sitting. A simple strategy is to set a timer or reminder to stand up and move every 30 minutes. Getting a glass of water, or stretching your legs can improve blood flow and reduce pressure on your pelvic area. These small, frequent movements keep your pelvic muscles engaged, promote better bladder emptying, and help reduce inflammation. Incorporating light physical activity throughout your day isn't just good for your prostate. It supports overall health, including heart, joint, and mental well-being. So, resist the urge to stay seated for hours at a time. Your prostate, bladder, and body will thank you for the extra care. Not drinking enough water. Many men over 60 try to reduce nighttime trips to the bathroom by simply drinking less water, especially in the evening. While this might seem like a smart way to avoid interruptions during the night, it can actually make prostate and urinary problems worse in the long run. When you don't drink enough fluids, your urine becomes highly concentrated and acidic. This concentrated urine can irritate both your bladder and your prostate gland, which sits just below the bladder. Chronic dehydration doesn't just cause discomfort, it triggers inflammation in the prostate. Inflammation is one of the primary factors that contribute to the prostate enlarging over time, a condition known as benign prostatic hyperplasia. This enlargement leads to symptoms like frequent urination, difficulty starting or stopping the urine stream, and the feeling that your bladder never empties completely. On top of that, many men in their 60s and beyond take medications that can unintentionally increase the risk of dehydration. Diuretics, blood pressure medicines, and some other common prescriptions can cause your body to lose more water, making it even more important to maintain proper hydration. If you don't drink enough water, toxins start to build up in your urinary system, placing extra strain on your bladder and prostate. The solution is straightforward. Drink water consistently throughout the day in small amounts rather than large gulps at once. Your urine color is a good indicator of hydration. Ideally, it should be clear or a very light yellow. If it's dark yellow or amber, your body needs more fluids. Don't be afraid of water. It's your prostate's best natural defense against inflammation and enlargement. By keeping yourself well hydrated, you help flush out toxins, reduce irritation, and support the healthy function of your urinary system. Remember, it's not about drinking large amounts right before bed but maintaining steady hydration all day long. This approach helps minimize nighttime bathroom visits while protecting your prostate and bladder health. What you can do today to protect your prostate. They are effective, proven strategies that have the potential to dramatically improve your quality of life. By making even one of these changes, you can reduce uncomfortable symptoms like frequent nighttime trips to the bathroom, difficulty urinating, and the frustration of relying on medication. Start small. Choose just one habit to focus on this week. Maybe it's drinking more water throughout the day to keep your urinary tract healthy and reduce irritation. Or perhaps it's committing to getting up and moving for a few minutes every half hour to improve blood flow and relieve pressure on your prostate. You could also cut back on red meat and processed foods, opting instead for lean proteins and fresh vegetables that support hormone balance and reduce inflammation. Remember, improvements won't happen overnight, but consistency is key. Your body has a remarkable ability to heal itself, especially when given the right support. By making steady, manageable changes, you'll give your prostate the chance to recover and maintain its health naturally over time. It's important to know you're not alone in this. Millions of men over 60 face similar challenges, and many have successfully turned their health around by adopting healthier habits. No matter your age or current condition, it's never too late to take control. By prioritizing your prostate health today, you're investing in better sleep, more energy, and greater comfort for years to come. Take that first step, your prostate will thank you. When I first began practicing medicine over 25 years ago, I expected the biggest threats to my patients' health after 50 would be heart disease, cancer, or diabetes. But one of the most dangerous and most overlooked threats I saw again and again was glaucoma. It doesn't cause pain. It doesn't blur your vision in the early stages. It doesn't come with warning lights or sirens. Yet it quietly and permanently damages the optic nerve, slowly robbing people of their vision, especially Americans over 50. By the time most people realize they have glaucoma, they've already lost part of their vision, and they can't get it back. And that's what makes it so frightening. Glaucoma doesn't get much attention, yet it's the second leading cause of blindness in the United States, according to TA. That's why this article matters. If you're over 50, it's time to take glaucoma seriously, because unlike many other age-related conditions, you can't feel glaucoma coming on. There are no obvious symptoms in the early stages, and once vision is gone, it's gone for good. So let's break what glaucoma actually is, who's most at risk, why early detection is everything, and what you can do right now to protect your vision for the years ahead. As someone who's helped thousands of patients over the last 2 decades, I can tell you, your eyesight is too valuable to take for granted. What is glaucoma, and why is it so dangerous for adults over 50? Glaucoma is not just one condition, it's a group of progressive eye diseases that target the optic nerve, the vital pathway that sends visual information from your eyes to your brain. Without a healthy optic nerve, your brain simply can't see what your eyes are looking at. And that's where the danger lies. In most cases, glaucoma is caused by an abnormal buildup of pressure inside the known as intraocular pressure. Over time, this pressure damages the delicate fibers of the optic nerve, slowly robbing you of your vision, often without warning. For Americans over the age of 50, glaucoma poses a serious threat to independence and quality of life. Vision loss can mean no longer driving, reading, or recognizing the faces of loved ones. And the worst part? In most cases, there are no early symptoms, no pain, no noticeable vision changes, no redness or irritation, just slow, silent damage. This is why glaucoma is often referred to as the silent thief of sight. By the time most people realize something's wrong, the damage is permanent. Studies show that by the time you notice vision loss, up to 40% of your optic nerve fibers may already be gone, and once they're gone, they can't be regenerated. Unlike cataracts, which are treatable with surgery, or dry eyes, which cause noticeable discomfort, glaucoma doesn't alert you to its presence. It starts by attacking your peripheral, side, vision, which is easy to miss in day-to-day life. As it progresses, that blind spot slowly closes in, creating tunnel vision, and in advanced stages, it can lead to total blindness. That's why adults over 50 must treat glaucoma with the same level of seriousness as heart disease or cancer. It may not be fatal, but it steals your ability to live fully, independently, and safely. If you're in your 50s, 60s, or beyond, and haven't had a full eye exam in the past 1 to 2 years, now is the time. Early detection is the only way to stop glaucoma before it causes irreversible damage. Who's most at risk after 50? Glaucoma can develop at any age, but the risk rises dramatically as we grow older. For Americans over 50, it's not just a possibility, it's a real and growing threat that deserves your full attention. Let's break down the key risks. Americans over the age of 50, especially after 60. The aging process naturally leads to structural changes in the eye, including reduced drainage efficiency of intraocular fluid. This can cause elevated eye pressure, the most common trigger for glaucoma. By the time you reach your 60s, your odds of developing glaucoma double with each passing decade. If you're in your 50s, it's time to start screening. If you're over 60, annual eye exams are not just recommended, they're essential for early detection. African Americans over 40. Research shows that African Americans are up to 6 times more likely to develop glaucoma than white Americans, and it tends to occur earlier and more aggressively. Vision loss can happen faster and may be more severe. If you're part of this demographic and over 40, consistent eye care should be a top health priority. People with a family history of glaucoma. Glaucoma runs in families. If your parents, grandparents, or siblings have been diagnosed, your risk increases significantly. Genetics play a powerful role, especially in primary open-angle glaucoma, the most common type. If glaucoma is part of your family history, even if you don't have symptoms, you should begin regular screenings by age 40 and never skip them after 50. Individuals with diabetes, high blood pressure, or cardiovascular disease. Chronic health conditions like type 2 diabetes and hypertension don't just harm your heart, they also damage the delicate blood vessels in your eyes. Poor circulation and inflammation can contribute to optic nerve damage and increased eye pressure. If you're managing any of these conditions, make sure your primary care physician and eye doctor are working together to protect your long-term vision. Long-term users of corticosteroids. If you've been using steroid medications, especially steroid eye drops, inhalers, or oral corticosteroids, for extended periods, your risk of developing glaucoma increases. These medications can raise intraocular pressure over time, sometimes without warning signs. If you rely on corticosteroids for chronic inflammation, asthma, or autoimmune conditions, ask your eye doctor to monitor your optic nerve regularly. If you fit into one or more of these groups, don't wait. Many Americans over 50 assume that if they're not experiencing vision problems, their eyes must be fine. But that's exactly why glaucoma is so dangerous. It progresses silently until irreversible damage is done. If you fall into any of these high-risk categories, make comprehensive eye exams part of your routine healthcare. Ask specifically for glaucoma screening, including pressure tests and optic nerve imaging. Track your results over time, and don't settle for quick vision checks at the pharmacy. Your eyesight is one of your most precious assets. Taking action now, before symptoms appear, could save it. How glaucoma silently steals your vision after 50. One of the most dangerous aspects of glaucoma, especially for adults over 50, is that it progresses silently. Unlike many other health issues, glaucoma doesn't start with sharp pain, redness, or sudden loss of vision. Instead, it creeps in slowly, often unnoticed for years. That's exactly what makes it so devastating. The most common form of the disease is called primary open-angle glaucoma. It develops gradually, beginning with a subtle loss of peripheral vision. You might not notice anything at first. You can still read, watch TV, and drive. But little by little, your field of vision begins to shrink, and you don't realize it until it's too late. In fact, by the time most people detect a real change in their sight, up to 40% of their optic nerve fibers may already be permanently damaged. And here's the harsh truth: vision lost to glaucoma cannot be restored. Once that nerve damage is done, it's irreversible. There's also a less common, but more dramatic, form known as angle closure glaucoma. This type strikes suddenly and is considered a medical emergency. It can cause intense eye pain, severe headaches, blurred vision, halos around lights, and even nausea. Without immediate treatment, it can lead to permanent blindness within days. Fortunately, angle closure glaucoma is rare, but the slow, creeping damage of primary open-angle glaucoma is far more common, and far more insidious. That's why glaucoma is often called the silent thief of sight. You feel nothing, you see nothing wrong, yet the disease is quietly robbing you of your vision day by day. If you're over 50, this is your wake-up call. Don't wait until your vision is compromised. By then, the damage may already be done. The only way to stop this silent vision killer in its tracks is through regular, comprehensive eye exams. The only way to catch glaucoma early, what every American over 50 needs to know. Glaucoma is one of the leading causes of irreversible blindness in the United States, and yet, millions of adults over 50 are walking around with it right now and don't even know it. Because it develops silently, without pain or obvious symptoms, until major vision loss has already occurred. So how can you protect yourself? There's only one proven, effective way to catch glaucoma early: a comprehensive dilated eye exam performed by an eye care professional. Let's be clear, this is not the basic vision test you get at the DMV or pharmacy kiosk. It's also not just reading letters off a chart. A real glaucoma screening involves advanced diagnostic tools and must be done by an optometrist or ophthalmologist. Here's what a proper glaucoma evaluation should include: intraocular pressure measurement. This test measures the fluid pressure inside your eyes. Elevated intraocular pressure is one of the most important risk factors for glaucoma. But here's the catch: not everyone with high pressure has glaucoma, and not everyone with glaucoma has high pressure. That's why this is just one part of a full screening. Optic nerve imaging, OCT or fundus photography. Your optic nerve transmits visual signals from your eye to your brain. With glaucoma, this nerve slowly deteriorates. Modern imaging tools like optical coherence tomography create a high-resolution map of the optic nerve to detect early structural damage, often years before you notice any vision loss. Visual field testing. This test checks your side vision, which is typically the first to be affected by glaucoma. You'll look into a device and click a button when you see tiny lights appear. The machine then maps out any blind spots in your visual field, subtle losses you may not be consciously aware of. Eye angle evaluation, gonioscopy. This step allows the doctor to examine the drainage angle inside your eye, where fluid should exit. Some types of glaucoma, like angle closure glaucoma, can cause sudden and dangerous spikes in pressure if this angle becomes blocked. A gonioscopy helps determine whether your eye anatomy puts you at risk. How often should you get checked? If you're over 50, you should have a comprehensive, dilated eye exam at least once every 1 to 2 years, even if you think your vision is fine, because you won't feel glaucoma happening. Vision loss starts in your periphery. You can lose up to 40% of your visual field before you notice a problem. That's why catching it early, before symptoms appear, is the only way to preserve your vision. Bottom line for adults over 50. If you're 50 or older, you're in the age group most vulnerable to glaucoma. Don't wait for blurry vision, eye pain, or other symptoms. They often don't show up until it's too late. Make a dilated eye exam part of your regular health checkups, just like your colonoscopy or blood work. If you have a family history of glaucoma, diabetes, or are African American over 40, you should get checked even more frequently. Take action today. Protecting your sight starts with one simple step: book a real eye exam. It takes less than an hour, it's painless, and it might just save your vision. Your eyes are worth it. Can glaucoma be cured? Glaucoma cannot be cured. Once the optic nerve is damaged and vision is lost, there's no way to bring it back. That's why this disease is so dangerous, and why early detection is absolutely critical. But here's the good news: glaucoma can be managed, and for millions of Americans over 50, the right treatment can help preserve vision for decades. When caught in its early stages, modern medicine offers a wide range of tools to slow or even stop the progression of the disease. The goal is to reduce intraocular pressure and protect the optic nerve from further damage. Here are the most common and effective treatment options available. 1. Prescription eye drops. For most people, eye drops are the first line of defense. These medications help lower the pressure inside your eyes by either decreasing fluid production or improving fluid drainage. You may need to use them once or several times a day, every day, for the rest of your life. Consistency is critical. Missing doses can quickly undo progress and allow damage to continue. 2. Oral medication. When eye drops alone aren't enough, your doctor may prescribe oral medication. These are usually taken in pill form and also work to reduce eye pressure. Some are used short-term, while others may be part of long-term therapy. It's important to monitor for side effects and stay in close contact with your ophthalmologist, especially if you have other health conditions like diabetes, high blood pressure, or kidney issues. 3. Laser therapy. Laser treatments have come a long way in recent years. A common procedure called laser trabeculoplasty uses focused light to help the eye drain fluid more effectively. It's usually quick, painless, and performed in the doctor's office. In many cases, laser therapy can reduce or eliminate the need for daily eye drops. However, results may fade over time, and repeat treatments may be necessary. 4. Surgical procedures. For more advanced cases, glaucoma surgery may be recommended. These procedures are designed to create new drainage pathways or implant small devices that help control eye pressure. Common options include creating a small flap to help fluid drain, tube shunt surgery, placing a tiny tube in the eye to redirect fluid, minimally invasive glaucoma surgery, a newer, less invasive approach with faster recovery. While surgery carries some risks, it can be a highly effective way to preserve vision, especially when medications and lasers aren't enough. The bottom line for adults over 50. If you're over 50, here's what you need to remember. Glaucoma may not be curable, but it is controllable. And the sooner it's diagnosed, the more vision you can save. The key is early intervention. Once damage is done, it's permanent. But with the right treatment plan, and regular follow-ups, you can stay ahead of this disease and protect your sight well into your later years. Schedule an eye exam today. Your vision is worth it. Everyday habits that protect your eyes after 50. If you're over 50, protecting your vision is not just about getting glasses, it's about making smart daily choices that support your eye health and help reduce your risk of developing serious conditions like glaucoma. While routine eye exams are essential, what you do every day plays a big role in preserving your eyesight long-term. Here are the habits I strongly recommend to all my patients over 50. 1. Wear UV protective sunglasses daily. The sun's ultraviolet rays don't just damage your skin, they can harm your eyes too. Long-term exposure to UV light can contribute to cataracts, macular degeneration, and even worsen optic nerve damage linked to glaucoma. Choose sunglasses labeled 100% UVA/UVB protection and wear them whenever you're outside, even on cloudy days. Wraparound sunglasses or wide-brimmed hats offer even more protection. Exercise regularly to support eye pressure. Physical activity isn't just good for your heart, it's one of the best ways to naturally reduce intraocular pressure, a key factor in glaucoma progression. Aim for at least 30 minutes of moderate exercise, like brisk walking, swimming, or cycling, 5 days a week. Regular movement helps improve blood flow to the eyes and optic nerves. Avoid exercises that involve straining or holding your breath, like heavy lifting or certain yoga poses, as they can temporarily raise eye pressure. Limit caffeine to avoid eye pressure spikes. Many Americans love their coffee, but after 50, moderation matters. Research suggests that high doses of caffeine may raise intraocular pressure in people who are susceptible to glaucoma. Try to limit caffeine to no more than 1 to 2 cups of coffee per day, especially if you've already been diagnosed with elevated eye pressure. Switch to green tea. It contains antioxidants like catechins that may support overall eye health. Eat a vision-friendly diet. What you eat can make a real difference. Certain nutrients help protect your eyes from oxidative stress and inflammation, both of which play a role in age-related eye diseases. Focus on leafy greens, spinach, kale, collards, for lutein and zeaxanthin. Fatty fish, salmon, sardines, mackerel, for omega-3 fatty acids. Colorful carrots, bell peppers, sweet potatoes, for beta-carotene and vitamin C. Nuts and seeds for vitamin E and zinc. Follow the Mediterranean diet. It's one of the most eye-friendly and heart-healthy eating patterns, especially for older adults. Quit smoking. it's never too late. Smoking increases your risk of nearly every age-related eye disease, including glaucoma, cataracts, and macular degeneration. It damages blood vessels, reduces oxygen flow to the eyes, and accelerates optic nerve damage. If you smoke, talk to your doctor about nicotine replacement therapy or evidence-based quit programs. Quitting today can significantly reduce your risk of vision loss, even if you've smoked for decades. Many of my patients over 60 have successfully quit, and they often say they feel more energized and sleep better. Manage chronic conditions that affect eye health. Your eyes don't work in isolation, they're closely linked to your overall health. Uncontrolled diabetes, high blood pressure, and high cholesterol are all associated with a higher risk of glaucoma and other eye disorders. Monitor your blood pressure and blood sugar regularly. Take medications as prescribed. Follow up with your primary care provider. Keep cholesterol and inflammation under control through diet and movement. Studies show that people with well-managed diabetes have a significantly lower risk of diabetic retinopathy and glaucoma progression. Final word on eye habits after 50. These daily habits won't reverse glaucoma, but they can help slow its progression, preserve your existing vision, and reduce your risk of developing eye disease in the first place. Remember, vision loss from glaucoma is permanent, but with the right habits and early action, it's also largely preventable. Take care of your eyes the same way you take care of your heart or joints, because good vision is a critical part of healthy aging and independent living. Warning signs of glaucoma you should never ignore after 50. Glaucoma is a leading cause of vision loss among Americans over 50. Yet many remain unaware they have it because early symptoms are often subtle or non-existent. Detecting glaucoma early can save your sight. If you're experiencing any warning signs such as sudden vision loss, eye pain, halos around lights, headaches with eye strain, or tunnel vision, seek immediate professional help. Common warning signs of glaucoma in adults over 50. Sudden or gradual vision loss or blurring. Persistent eye pain or pressure. Seeing halos or colored rings around lights. Frequent headaches combined with eye strain. Loss of peripheral vision or experiencing tunnel vision. Ignoring these symptoms can lead to permanent vision impairment. Regular eye exams and early diagnosis are critical, especially for those over 50. As an eye health specialist with over 25 years of experience, I have treated many patients who lost their vision simply because glaucoma wasn't caught early enough. The good news is that glaucoma-related blindness is preventable with timely care. If you are over 50, don't wait until symptoms worsen. Schedule regular comprehensive eye exams, adopt vision-friendly lifestyle habits, and stay informed about glaucoma risks and prevention. Protecting your eyesight is essential for maintaining your independence and quality of life as you age. Remember, your vision is too valuable to ignore early warning signs. Over 60. 4 cheeses you should never touch and 4 you must eat daily. Senior health tips. 4 cheeses you should eat and 4 you should avoid after 60, science-backed guide for seniors. Did you know most seniors are eating cheese the wrong way? Did you know that more than 85% of Americans over 60 eat cheese at least twice a week? Cheese is one of the most loved foods in the country, and for good reason. It's delicious, versatile, and packed with nutrients. But here's the shocking truth. Most every senior makes at least one critical mistake in the cheese aisle, and it could quietly be cutting years off their life. Scientific research shows that certain types of cheese can double your risk of heart attack and reduce your chances of reaching 80 by nearly 40%. The worst part? Most people have no idea which cheeses are harming them, because they look perfectly normal on store shelves. The good news is, the solution is surprisingly simple. By learning which cheeses to choose, and which to avoid, you can protect your heart, keep your bones strong, and even support better brain function as you age. What you'll learn today. In this guide, we're going to break down the 4 healthiest cheeses you should eat regularly after 60. The 4 cheeses you should never touch if you care about your heart, your memory, and your future health. The worst cheese on the list has been linked to an 80% higher risk of stroke, and chances are, you've already eaten it this week without thinking twice. Join the conversation. Before we dive into the list, I'd love to hear from you. Where are you watching from? How old are you? And what's your favorite cheese? Share your answer in the comments. We read every single one because your experience might inspire someone else to make healthier choices. And if you're serious about staying strong, active, and healthy well into your 70s, 80s, and beyond, make sure to subscribe and turn on notifications so you never miss a new science-backed tip. Let's begin. The 4 best cheeses for people over 60. These are not just tasty options, they're backed by research for supporting bone health, improving digestion, and even lowering your risk of age-related diseases. The 4 best cheeses for seniors over 60. 4. Aged Gouda, a natural bone and heart protector for Americans over 60. If you are over 60 and looking for a cheese that supports strong bones, a healthy heart, and better digestion, aged Gouda should be at the top of your list. Unlike young or mild cheeses, Gouda that has been aged for 18 months or longer goes through a transformation that makes it a true nutritional powerhouse. Why aged Gouda is ideal for seniors. As we age, our digestive systems often become less efficient at breaking down and absorbing nutrients. Aged Gouda solves that problem naturally. During the long aging process, the proteins in the cheese are broken down into small, easily digestible peptides. This makes it much gentler on the stomach and easier for older adults to absorb its valuable nutrients compared to fresh or processed cheeses. But the biggest reason to add aged Gouda to your diet is its high content of vitamin K2. This vitamin is rarely discussed in mainstream nutrition, but it is essential for anyone who wants to maintain heart health and strong bones as they age. The calcium traffic director. Calcium is crucial for bone health, but in many older adults, it ends up in the wrong place, inside the arteries instead of in the bones. Vitamin K2 acts like a traffic controller for calcium, moving it away from your arteries and into your bones where it belongs. Scientific studies from Japan have shown that people with higher vitamin K2 intake had 50% less arterial calcification and significantly stronger bones, reducing the risk of fractures and cardiovascular problems. Just 1 ounce of aged Gouda provides around 75 micrograms of vitamin K2, which is more than most Americans get in an entire week. Considering that low K2 levels are linked to osteoporosis and heart disease, this makes aged Gouda a powerful ally for seniors. More health benefits you should know. Rich in CLA, conjugated linoleic acid. CLA is a healthy fatty acid that research links to reduced belly fat, improved immune function, and even protection against certain types of cancer. Gut-friendly postbiotics. During aging, beneficial bacteria create natural compounds called postbiotics. These support a healthy gut microbiome, reduce inflammation, and may even improve mood and mental clarity by supporting the gut-brain connection. Aged Gouda is virtually lactose-free, making it safe for most people who are lactose intolerant. The best way to eat aged Gouda. For maximum health benefits and flavor, eat 1 to 1.5 ounces per day. Let it sit at room temperature before eating. This enhances flavor and makes its nutrients more bioavailable. Combine it with apple slices or whole grain crackers. The fiber in these foods helps your gut absorb Gouda's beneficial compounds and work synergistically with its natural postbiotics. Aged Gouda isn't just a delicious snack, it's a strategic food choice for Americans over 60 who want to protect their heart, strengthen their bones, and support healthy digestion. Adding it to your weekly diet can be one of the simplest ways to invest in long-term health. Parmigiano Reggiano, the king of cheeses, for a reason. If there's one cheese every American over 60 should consider adding to their diet, it's authentic Parmigiano Reggiano. Known as the king of cheeses, this Italian classic is far more than a flavorful topping for pasta. It is a nutrient-dense superfood that supports bone health, muscle maintenance, and even brain function as we age. Parmigiano Reggiano is not the pre-grated powder in green cans you find in most grocery stores. Authentic Parmigiano is crafted in Italy using traditional methods that have been perfected for nearly 900 years. The strict production process and long aging period give this cheese a nutritional profile that makes dietitians and researchers take notice. Why Parmigiano Reggiano is a nutritional powerhouse. High quality, easily digestible protein. 1 ounce of authentic Parmigiano Reggiano provides around 10 grams of protein, but what sets it apart is the digestibility. The cheese is aged for 24 to 36 months, during which its proteins are broken down into smaller peptides and free amino acids. This process makes the protein almost pre-digested, meaning your body absorbs it quickly and with minimal effort, an essential benefit for older adults, whose digestion tends to slow with age. Because it contains all 9 essential amino acids, Parmigiano Reggiano is considered a complete protein source, rivaling meat and eggs in quality. Seniors looking to maintain or rebuild muscle mass can benefit from adding it to their diet, especially if they struggle to consume large portions of meat. Bone-strengthening calcium with perfect absorption. Parmigiano Reggiano is one of the richest natural sources of calcium, providing 330 milligrams per ounce, more than a glass of milk. But unlike many dairy products or calcium supplements, this calcium is paired with the ideal balance of phosphorus and magnesium, which maximizes absorption. Italian researchers have found that the calcium in Parmigiano Reggiano has nearly 100% bioavailability compared to the 25 to 30% absorption rate of most calcium supplements. For seniors concerned about osteoporosis, adding this cheese to a daily diet can be a game changer for maintaining bone density and reducing fracture risk. Mood and brain function support. Parmigiano Reggiano contains high levels of tyrosine, an amino acid your brain uses to make dopamine and norepinephrine. These neurotransmitters are crucial for mental clarity, motivation, and alertness, qualities that often decline with age. It also naturally contains compounds called casomorphins, peptides that have a calming effect on the nervous system. Some research suggests these compounds may help improve sleep quality and reduce mild anxiety, making Parmigiano a smart choice for seniors dealing with stress or age-related sleep disturbances. 4. Lactose-free and gut-friendly. The long aging process naturally removes almost all lactose, making Parmigiano Reggiano well tolerated by people with lactose intolerance. It also contains beneficial bacteria that survive the aging process, helping support gut health, a key factor in immunity and nutrient absorption as we get older. How to eat Parmigiano Reggiano for maximum benefits. The way you eat this cheese matters. Instead of grating it over pasta, follow the traditional Italian method. Break it into small chunks using a knife rather than grating. This preserves its crystalline texture and keeps its nutrient structure intact. Eat it after meals. Italians often enjoy a small piece as a digestive aid. The enzymes in aged Parmigiano can help your stomach break down other foods more efficiently. Pair it wisely. A few drops of aged balsamic vinegar or a handful of walnuts can enhance mineral absorption and add extra antioxidants. The bottom line for Americans over 60, Parmigiano Reggiano is more than just a cheese, it's a functional food that supports strong bones, better digestion, sharper focus, and improved mood. For seniors looking to maintain independence and vitality, swapping out processed cheeses for a small daily serving of this Italian classic could make a meaningful difference in long-term health. Grass-fed raw cheddar, the probiotic powerhouse every senior should eat. If you are over 60, grass-fed raw cheddar deserves a place in your refrigerator. Unlike the heavily processed cheeses most Americans buy, this properly aged cheese from grass-fed cows is nutrient-dense, anti-inflammatory, and gut-friendly, making it an excellent choice for heart, bone, and brain health. What sets grass-fed raw cheddar apart is that it's made from raw milk and aged for at least 60 days. This aging process not only eliminates harmful bacteria but also preserves live enzymes and probiotics that pasteurized cheeses simply don't have. These natural probiotics are essential for seniors because support digestion. Healthy gut bacteria help break down and absorb nutrients more efficiently, reducing bloating and digestive discomfort, which are common as we age. A healthy gut is the foundation of a strong immune system, helping you fight off infections more effectively. Improve mental health. Research on the gut-brain axis shows that probiotics may help reduce anxiety, improve mood, and support mental clarity, important benefits for maintaining cognitive health in later years. But probiotics are only part of the story. Grass-fed raw cheddar is also packed with vitamins and healthy fats that most Americans over 60 are missing. Vitamin A, retinol supports vision, skin health, and immune function, crucial for bone strength and protection against osteoporosis, especially in seniors who get little sun exposure. Vitamin E, a powerful antioxidant that protects cells from age-related damage. Vitamin K2 directs calcium away from your arteries and into your bones, reducing the risk of arterial calcification and fractures. CLA, conjugated linoleic acid, and omega-3s, anti-inflammatory fats that protect your heart and may help reduce body fat. Because it's made from the milk of grass-fed cows, raw cheddar has 5 times more CLA and significantly higher omega-3 levels than conventional cheddar. It's essentially a natural supplement for joint, heart, and brain health, without the pills. How to eat grass-fed raw cheddar for maximum benefit. Let it sit at room temperature for 20 to 30 minutes before eating. This preserves its enzymes and probiotics and improves flavor. Pair it with fermented vegetables such as sauerkraut or pickles. This combination creates a probiotic powerhouse that supports gut health and digestion. Stick to 1.5 to 2 ounces per serving. This amount provides all the health benefits without overloading on saturated fat. Why it matters for Americans over 60. As we age, our digestive efficiency declines, our bones lose density, and our immune system weakens. Choosing high-quality, probiotic-rich cheeses like grass-fed raw cheddar is a simple, delicious way to give your body the nutrients it needs to stay strong and healthy. Swiss Gruyere, the best cheese choice for Americans over 60. When it comes to choosing cheese for optimal health after 60, authentic Swiss Gruyere stands out as one of the smartest options you can put on your plate. Unlike many popular cheeses that can raise inflammation and stress the heart, Gruyere is naturally anti-inflammatory, heart-friendly, and packed with nutrients that directly support aging bodies. Why Swiss Gruyere is a nutritional powerhouse for seniors. 1. Supports heart and artery health. One of Gruyère's biggest benefits comes from propionic acid, a compound produced by the beneficial bacteria used in its fermentation process. Clinical research links propionic acid to lower LDL cholesterol levels, improved arterial flexibility, which helps maintain healthy blood flow, reduced cancer risk, particularly in the colon, due to its ability to support a healthy gut environment. For Americans worried about cardiovascular disease, the leading cause of death after 60, choosing a cheese that actively supports heart health is a game-changer. Boosts the body's natural defense against aging. Gruyere is one of the richest dietary sources of glutathione precursors, compounds your body uses to produce glutathione, often called the master antioxidant. Why does this matter? Glutathione protects your cells from oxidative stress, which accelerates aging, weakens the immune system, and contributes to memory decline. After 60, natural glutathione production drops significantly, making foods that boost it essential for staying healthy and mentally sharp. The specific amino acids in Gruyere, including cysteine and glycine, are key building blocks for glutathione synthesis, giving it an advantage over other protein sources like meat or eggs. Helps maintain muscle mass after 60. Muscle loss, or sarcopenia, is a major issue for older Americans, often leading to weakness,